here with Dr. Andrew Winge. How are you, bro?
I'm well. I'm well. Thanks for setting this up. I've never done a podcast with this kind of view. This is incredible. So
Beautiful.
Thank you. Yeah.
Welcome, bro.
Yeah,
I'm hosting Dr. Winge from Abu Dhabi. He drove down
That's
to
right.
Dubai.
Drove down with the family today just for this occasion, just to see you.
Thank you, bro.
Actually, to meet your wife and your baby too.
First time we meet in person.
Yeah, that's right.
We've done 2 podcasts before remotely.
Yeah, it was at least 2. Yeah. Yep.
The difference today, we're in the UAE. And so although we have discussed specific heart health risks with anabolic steroids and just being a dude in general, because that in and of itself is a risk to your heart.
Yes, it is. Yes, it is.
As you know.
Male gender. Absolutely, yeah.
We want to talk about health issues specific to the UAE because we believe there is some issues we see here more than in other places.
For sure.
For sure? And why are you a good person to speak of this?
Well, I may not be the best person to speak on it, but I've been here now. It's been almost a year working full time in a really, really busy urban emergency department. So over the course of a year, I think I've gotten a good idea of what this population has to deal with. And it's not that much different than in the US but in some ways it's actually really, really different. And we've talked about this offline multiple times. The prevalence of cardiovascular disease here, it's incredibly high, and it's incredibly prevalent in people even under the age of 40. That's probably the number one thing that blew me away. It was incredibly rare for me to activate the cath lab for a big ST elevation MI and somebody under the age of 40 when I was back in the States. I mean, not that it didn't happen, but a couple times a year. I think I told you the other day, like I had 3 in one day that were under. One of them was 50. The other 2 were both under age 35.
They died?
3. No, they all survived, thank God. But they all came in with massive heart attacks, with really serious lesions. A couple of them had triple vessel disease, and these were guys. The first 2 were both of them were under 35. So it just. You just don't see that back in the States. It's very rare, but here it's almost like a dime a dozen. These poor guys. So the prevalence of heart disease is in the young is really it kind of took me off guard, actually. And then everything that comes with that, so diabetes, hypertension, lipid issues, you see that in the younger. And it's not just the Emiratis, of course. This is a big multicultural country. So the other 85 to 90% of the population comes from South Asia. So that's a big demographic that gets early heart disease. I see a lot of that, but it's everybody. So it's, and we can, I have some theories about why that is, but it keeps me busy. I don't deal with the knife and gun and the drug stuff that I used to deal with, which is great because I kind of had my fill of that, but in its place now, I take care of a lot of acute cardiovascular disease problems, kidney failure, and diabetes related complications. So it's,
okay.
There's never a slow day.
Got some follow-ups because
Yeah.
I want to define a few things for the audience. You're in Abu Dhabi. I'm here in Dubai. Now in Dubai, we have about 90% immigrants.
Yeah.
So most people here are not Emiratis, but in Abu Dhabi, there's a difference. There's more locals
There's
there.
more locals, yeah.
There's more locals there.
Yeah. I don't know exactly what the percentage is. I mean, some of the listeners can fill us in on that, but it's, I don't know, it's probably 15%, maybe 20.
Okay.
Yeah,
and roughly speaking, the men and women that come in with these heart issues, percentage-wise, how much are local Emiratis versus other?
That's a good question. It's, I feel like it's equally distributed.
Okay, equally
between
distributed.
like the bulk of the patients are South Asians, but they're the bulk of the population anyway.
Yes.
So folks from India, Sri Lanka, Bangladesh, etc. But equal number of in terms of percentage of local Emiratis as well. It's a very big problem there in that demographic as well. So
now to the US, Australia, UK, they have similar rates of cardiovascular disease.
Yeah.
Similar-ish.
Yeah.
But there are huge immigrant populations there too. So we're seeing something unique to the UAE.
Yeah.
And this is why I have always sussed the fact that when you look over the skyline, it's hazy. Okay.
Yeah,
So the air quality here can be so bad.
Yeah.
And I have consulted people on this. So if you think I'm wrong, please correct me. It's about the same as smoking half a packet of cigarettes a day, especially in the warmer months, if you're outside all day.
That's right. That's
which
right.
is bad. And a lot of these Southeast Asians are.
They are. Yeah.
And they smoke.
Yeah, exactly. And then on top of that, they smoke. Yeah. So very high prevalence, even with the local Emiratis of tobacco use as well. So you can't write that off, of course. So, like any chronic condition, cardiovascular disease, it's an interplay between genetics, environment, lifestyle, right? So, and there are issues in all three of those areas here, and not just with the local Emiratis, but with the expat population too. But the air quality, I think, is a big one. It's going to be tough to quantify like how much that contributes, to, any given particular individual. But I mean, look outside, you see how hazy it is here. And I agree with you. If you're out all day on that, it can't be good. It can't be good.
It's not.
So yeah, I agree.
It's something I dived into because I used to work on construction sites. And basically the PMA score or the AQI, once it exceeds 100, things start becoming noticeably worse.
Which it routinely does here.
Yes, right? Routinely does.
Yeah, for sure.
And you'll know the difference if you've lived in other countries where the AQI, like in Australia, is, just about 10 or 0.
Yeah.
Coming here, you'll know going outside, you feel it as you breathe. But just imagine that over a lifetime. But that is something that, at least for now, we can't do much about with these people, unfortunately.
No, it's tough.
I'll move that one aside for now. Just want to make a note that if you get a good air quality filter in your home, it makes all the difference.
Highly recommended.
Yeah. I've got them. You've got them.
Yep. I've got a big one for downstairs that does the entire downstairs. And then in my boys' bedroom and in the master bedroom, we each have our own little one.
Beautiful.
And when you change that filter out, it's pretty gross.
It's pretty gross, isn't it?
Gross.
Yeah, it is.
Yeah.
I've got the Coway Air Mega 400s and they're cheap. They're about 400 US.
Yeah.
And I've got
worth it.
4 of them and it's overkill for a 500 square meter house. 2-3 of them does the trick and they last for years. You just got to change that filter every 6 months.
Yep.
Cheap.
Well, I noticed since I got them, that little sniffle that I was having went away, and the little allergic shiners that my 2-year-old was getting have gotten a lot better too. So I know they're working. And again, when you change the filter out, you can see
it.
Yeah, I'd rather have that in the filter than in my lungs or my sinuses. Yeah, for sure.
So good insurance. If you're here in the UAE, get a good home filter. Some aircons, some HVACs are really good at doing it. The place I'm in right now is.
Yeah.
But it just makes it better. And also your vehicle, because I bring the air quality monitor with me in vehicle.
Oh, yeah.
And all of them have different AC systems. The vehicle I'm in at the moment, it's a G-Wagon. It's, it's a little pricey for some families, but that has a good one. But so do Land Cruisers, these Nissans also that a lot of people use. It's really good.
Yeah. No shortage of Nissans here.
No shortage of Nissans, Okay. So we can't do much about that, even though I've heard that they are making it rain literally. I don't know how they do that, but the rain brings the air quality index down.
I've heard that too. Yeah, for sure. But you're right. You can imagine if you're out in this all day, and you're breathing this particulate matter, not only are you going to get lung disease, but that's an inflammatory. It initiates an inflammatory process, which is part of what leads to cardiovascular disease. So it makes sense. This was an issue I remember reading about in Mexico City before they took measures to clean up the air quality there in Mexico City. There were high rates of lung cancer, high rates of COPD, and high rates of heart disease. And it was directly related to the serious pollution problem. Yeah. Mexico City's in a little bit of a valley. And so it would just collect in there. Yeah. So
it's interesting why it's not spoken about as much. It's just not a sexy topic. For example, in Bali, the air quality is terrible, but it's like where you go for health. And I think the irony here is you're going to Bali, the water quality makes you sick and the air is terrible. It's hardly a place of health. Number 2, what I think is the elephant in the room, but it is literally nowhere you look. How do I know? I have gone through Google, through Instagram accounts, popular doctors.
Yeah.
I can't speak Arabic, of course, but I've asked people here, prominent individuals, and it's the biggest issue here. at least where things start, diabetes in the UAE.
Oh yeah, it's huge, huge. Yeah, God, where do we even begin?
Okay, let's
It's a
start with the
huge.
stats. I remember them.
Yeah. You talked about them in one of your, and I will tell you, in my opinion, those stats it probably underrepresents
Wow.
the problem, for sure. Yeah, I've heard numbers as high as 40% for the local Emiratis. You know,
Full-blown diabetes.
I've heard that number thrown around. Probably a more realistic number is like 20 to 35% for diabetes, but then you also have another, probably another 20 or 30% with pre-diabetes. So your total exceeds 50% because, the risk, the cardiovascular risk from being a pre-diabetic to being a full diabetic, it's not that much different. We really, I think, should be just lumping those two together.
Yep.
It's not like you cross some magical hemoglobin A1C threshold. Oh, now it's 6.5. Now you're at risk. And, at 6.2, you're fine. Now it's a gradient of risk. So, yeah, it's crazy. UAE has been consistently in the top 10 for worldwide for diabetes prevalence. And it's not just like the isolated UAE. I mean, Saudi's pretty bad, and Kuwait and Qatar. It's the whole Middle East. And, there's a lot of reasons for that. Obviously, the little more sedentary culture now. And, obviously this time of year, it's miserable outside. So, how many of us are spending, time outside and burning calories and stuff? Kids are inside and, we're eating a lot more junk food and soda and things like that. So it parallels, obesity and diabetes go together. In fact, obesity really is, I believe, is sort of like the root cause of all the stuff that we're probably going to talk about today. It's, intimately involved in blood pressure, intimately involved, obviously, in diabetes and heart disease. And if you can, and you've talked about this, if you can fix the visceral body fat issues and you can correct the lack of muscle tissue, it goes a long way to solving all of these downstream problems. So, not to put the cart before the horse, because I'm sure we'll talk about that eventually. But the diabetes epidemic is a big problem. I routinely see diabetics. I mean, it's all day long, and they have really serious complications here. There's a lot more renal failure here, so a lot of and not just a lot of Emiratis, but also people from other places too on the dialysis or transplant list. See a lot of kidney transplants here, and that's many decades usually of uncontrolled diabetes with uncontrolled hypertension. Mostly there's other reasons you can lose your kidneys, obviously, but yeah, it's way more common here, way more common. And it's frustrating because, like, we know it's preventable. It is preventable.
Absolutely.
You don't have to go that way, even if you've got the genes that predisposed to that. If the interventions start early, which, if I had it my way, would start in childhood with everybody, really, you don't have to go down that road, but many people do, unfortunately.
Okay.
Yeah.
Now, there's a lot of fancy sciencey words being thrown around there, which I
Sorry.
understand at this point, but not everyone does. So we're going to backtrack.
Okay.
Definition of diabetes for the normie. So the normal person that doesn't know diabetes. Why? I'll tell you why this is important, because when you throw the word diabetes out there, most people say, yeah, that's bad. They have no idea what it actually does. Oh, blood sugar. Yeah, you got to watch that.
Right.
But I want you to talk about things like legs falling off, going blind.
Yeah.
Tell me what happens. Let's start with full-blown diabetes.
Yeah.
Let's not even talk numbers. What can happen to me if you see I've got full-blown diabetes, symptom-wise, clinically?
So, many times it depends on what your blood sugar. If you want to talk about acute symptoms, you could be running around with, a blood sugar of, like, say 300, and you have no idea. You have no idea. And you could do that for years and years until, one day you start noticing that, oh, I can't really feel my feet. I'm losing sensation in my feet, or I'm getting it feels like there's pins and needles in my feet, or like a burning, feels like someone's holding a match to my feet. So that's the neuropathy. So you start noticing things in certain organ systems. So the big three are the eyes, the kidneys, and then the peripheral nerves. So sometimes people, that's how they present to care. I've had a number of patients over the years come in and their chief complaint is blurry vision. And so you're like, oh, you're looking at their eyes. Their eyes look normal. Everything's fine. You check a blood sugar on them, and it's like 500. You know, so when the glucose in the blood gets that high, you know, it interferes with the cells in the retina. You can't see properly. And as soon as you give these people insulin and fluids, you get their sugar down, all of a sudden, miraculously, their vision clears up.
Wow.
So sometimes that's how they present, or they'll present with, like I said, with the nerve issues, which that's really hard to treat and really uncomfortable and sometimes like super disabling for people. You know, nerve pain is, I wouldn't wish that on anybody. You know,
it's 24/7.
24/7. Yeah,
can't sleep. It's just constant.
No, it's very uncomfortable. And then, you know, they end up with, you know, because you don't have proper sensation in your feet, you may not notice a little abrasion or a little cut that, you know, incidentally, you would, you know, you and I would notice it and we would immediately take care of it, put a Band-Aid on it. Well, they don't necessarily notice that. And now they get an infection. And because, you know, diabetes affects the small blood vessels, you know, you're not getting good blood flow. So you're not fighting that infection. So a little bit of staph gets in there, a little bit of strep, you know, some other bacteria takes hold. And then you get, you know, a diabetic foot ulcer or a deep space infection, like it goes into the bone. And that's how you end up losing a toe, losing your foot, losing your whole lower leg, because, you know, not only are you immune suppressed, but, you know, you're just more predisposed to get that initial injury. So that's why, you know, as a diabetic, when you go in for your routine checkups, you know, they always taught us in residency, shoes and socks off. Like you gotta look between the toes, and it's not always pretty in there. But you know, your best friend as a diabetic sometimes is your podiatrist, you know, because they keep the nails clean, and you know, the feet are a major source of problems and a major source of ER visits that I see. I'm routinely having to talk to my surgical colleagues to come down and take off a foot, you know, because
do you amputate foots often?
Yeah, I don't do the amputations. I call my surgeon friends to do it.
Okay.
Yeah. But I see them initially. I get the antibiotics going and the X-rays and CTs and,
you tell them
all that stuff.
Your foot's coming off.
Sometimes, yeah. You know, if I think there's a chance that they can save the foot, you know, obviously I'll talk to them about it. But sometimes it's gangrene. They don't come in. They literally don't notice it until the smell. It's surprising. Like there's so many people that like they never take their shoes off. You know, they'll go 24 hours without taking their shoes off.
And I didn't notice.
I didn't notice until, you know, sometimes I know. I walk in the room and I'm like, oh man, that's not good. You know, it's the smell of like dead flesh. You know, it's disgusting. Yeah.
Okay,
it's disgusting. So that's the extreme, right?
Yeah,
you wanted the extreme. That's the extreme.
Okay.
Yeah.
Well, we start there because that's the end. That's the end game.
It's kind of too late at that point. I mean, it's never too late, right, to make those changes to get things better. But a lot of damage has been done, a lot, you know, and so you're not going to get away scot-free at that point, you know. But you have a chance early on to reverse it and not need medications and, you know, potentially not go down that road.
That's an important one.
Yeah.
We'll talk about not needing medications, because even myself, doesn't matter what education you throw out there, there's going to be a lot of guys that just don't want to based on compliance.
Oh,
okay?
Yeah.
So we'll leave that for now, because
I get it. I don't want to take medicine either.
I hate taking meds,
unless
bro.
I have to. You know, unless I have to. So
that's diabetes extreme. Now I'm going to talk about insulin resistance, or it's a good word for it. It's basically a continuum of diabetes, but it's on the lower end.
Yeah.
But things are still bad at this point, right?
Yeah, they're not normal.
Tell us.
Yeah, they're not normal. So yeah, in this insulin resistant phase, you can still achieve normal blood sugars. It's just that your pancreas oftentimes has to put out a lot more insulin. So you need a lot more insulin to get that sugar under control. Your body has like very tight mechanisms to keep blood sugar under control. There's obviously major problems if it gets too low. That can be fatal. And there's major problems if it gets too high. Too low is acutely much more dangerous. Obviously, you can have a seizure, go into a coma, and die from low blood sugar. But high blood sugars, you know, have issues too. So that's insulin resistance. You can still get normal blood sugars, but your pancreas is working overtime. And typically, you know, there's a lot of like downstream effects from that. So you have, you know, high fasting insulin levels. Insulin does promote atherosclerosis, you know, high levels of chronic hyperinsulinemia, they call it. It promotes inflammation. It promotes, you know, essentially there's for lack of a better term, sort of accelerated aging, because you have this glucose circulating around, and it's not inert. It attaches itself to proteins in your blood, in all of your organs, and it damages those proteins, and so they become glycosylated, and so they don't function properly, and so you see essentially like accelerated aging if you have somebody who has chronically high blood sugars in that insulin resistant range. So it is a problem. But it's also kind of like the easiest way to pick it up as well. I mean, there's simple tests that you can do. Hemoglobin A1C, fasting insulins are great. You can do something called an oral glucose challenge where you drink this, a certain number of grams of really syrupy, disgusting glucose, and then you can measure insulin and you can measure glucose levels and you can pick this stuff up. But again, it's not something that people think about on a regular basis, and they really should, especially if you got a family history.
Okay.
Yeah.
I got let's reverse engineer. So I'm going to ask a few like quick questions. Answer them if you can.
Okay, I'll do my
in
best.
a minute or less. Why? Because if it's going to be really simple, I think the audience is going to understand it. It's going to force you to answer it for them.
Okay.
Okay.
All right.
Reverse engineer this. Who do you never see with insulin resistance and diabetes? What sort of person?
So if you want to give me like the avatar of like of the person I never see. So it's the guy under 15% body fat who exercises on a regular basis, and almost irrespective of how bad their diet is, those two things make a huge difference. They have a solid amount of muscle mass, and they have relatively low, certainly by like today's standards, they've got pretty low body fat, so sub 15%, and that's pretty much it. Those guys can get away with murder sometimes in their diet, not always. Genetics play a role in that, but yeah. No, I don't see the lean. I don't see triathletes. Triathletes do not come and see me. Never. Not one. Now, unless it's type 1. That's a whole different ballgame, right? It doesn't count. Yeah. No. If you're lean and I say muscular, I'm not talking about bodybuilder muscular, right? I'm talking about guys who have, I would just say a moderate or slightly above average amount of muscle tissue. You combine that with low body fat, especially visceral body fat, like we talked about earlier. They don't need me.
There you go.
They don't need me.
We just basically cured it for you in a minute. Okay, another quick one. These people that don't have diabetes, tell me what they would do in a typical 24-hour span, right out their day.
Yeah, well, I mean, clearly it's going to vary, and you know what? I have to caveat everything because nothing is always 100%. But there are people who are genetically gifted that's just their template, and they don't have to work very hard to keep that. Now, eventually, especially as they get into their 40s, the wheels will start to come off, and they're going to have to do some of the things I'll mention. But what they do is they eat in moderation. So they eat until they're full, and then they don't eat anymore. They tend to have psychologically a good relationship with food, so they don't have underlying emotional issues that they turn to food for. I think that's actually a big one. I think that maybe people don't appreciate as much. It's related to past trauma and the way that you grew up. If you have an unhealthy relationship with food, I mean, it's almost inevitable sometimes that you're going to eat excess calories, and then that puts you down the road. So they have an exercise regimen, and it doesn't have to be bodybuilding stuff at the gym. They run, they bike, they hike, they do body weight activity. They do something to move their body on a regular basis to not only build the muscle tissue that they have, but to maintain it as well. So it's fairly simple. And then of course they avoid all of the like common pitfalls. They don't smoke. I mean, that's sort of like the easy one. Like they don't smoke. They don't do drugs. They don't drink alcohol to excess. They do, those things are, in my opinion, easy to avoid. So they don't have any of those bad habits that we see like the general population have. If just that alone, I mean, that puts you at above 85 to 90% of the general, certainly like the US population. If you follow those habits, you're going to, unless you have really bad genetics, you're going to very likely outlive most of your contemporaries.
Wow, great answer.
Yeah.
It's interesting you said they don't drink, they don't take drugs, all this stuff. I think we're making this podcast for the people that have not got any serious addictions. I don't think I want to speak to this demographic because this is a real hard one. I don't know what to do with these people. That's for someone else. We're talking about the people that are, they're living well enough. They just might not know that going to the gym 3 times a week might save their life.
Exactly.
Literally.
Yeah, they don't know how important it is.
Yeah.
They don't know how important it is. And, a lot of these folks, they travel in social circles where going to the gym is not the norm, and if they are trying to make healthy changes, sometimes their buddies, I mean, I know you've seen it, I've seen it, like, oh man, what are you doing? Like, we're going to the bar Friday night. Like, let's go, and if you say, no, listen, I have to go to the gym, or, I don't want to go because I don't want to drink, they're going to needle you a little bit and give you a hard time. So your social group, if you run with guys who have bad habits, there's a tendency there to follow suit, right? So, I surround myself with people who have the same lifestyle that I do, and it makes it easier.
Makes it easier.
Makes it easier. Yeah.
Even for me, I'm a very disagreeable guy. So I could be that one person doing the drinking and everyone else is living healthy. In fact, I'm the fat guy in the group. Even though I might not look fat, all my mates are shredded.
Yeah.
But this is Dubai.
Yeah, of course. Well, this is the standards here are
like, very high.
Yeah.
I'm not walking into the gym, the in shape guy.
Yeah. I've told you at my gym, I'm the tiny guy in the gym.
But how old are you now?
I'll be 52 in 2 months.
Yeah. 52.
Yeah.
Great shape,
I'm doing
bro.
Okay.
Very good. Very
doing
good.
Okay.
Okay.
Yeah.
I digress. Diabetes is bad. We can just about prevent it entirely. All right. At least until you're in your 80s.
Yeah.
With weight training, some cardio, and not being too fat. That's it. That's the take-home point, guys.
I mean, that's
if you can't do that, I mean, we can't help.
Exactly. Yeah. And, it does require a certain amount of discipline. It requires education, again, getting back to just realizing just how important it is. And that's why I said you got to get, ideally, like, you have to get them as kids, because you build in those habits, in the 7 and 8 year old. This is just what we do. We play sports, we exercise, we spend time outside, we get lots of fresh air and sunshine. It's very difficult if you live a sedentary indoor life to age 45, and then all of a sudden now, you come see me or talk to you and be like, hey, you have to make this radical change in your life, which doesn't seem radical to us, but it's radical to them.
Sure.
They're not used to walking 3 city blocks, let alone going for a 3-mile run, or going to the gym, for 3 days a week. It's a big ask.
It is. So, I got asked this on a podcast the other day with Faris. He said, give advice to the youngsters. And I said, I was honest. I said, you want me to be honest? He goes, full honesty. I said, bro, if you don't enjoy exercise, who are you? Like, I'm not connecting with you. I enjoy it. This is not a chore.
Exactly.
So I'm not sure how to actually give advice to people to do things they don't enjoy. I don't do anything I don't enjoy.
Yeah.
How can you not enjoy exercise, guys? No, really. Okay, if you're in pain, I get it. But can you tell me how you could not enjoy exercise?
Precisely. Yeah, precisely. I love exercise. I love jiu-jitsu. I'm getting smashed by some 300-pound guy. I'm still kind of having a good time. You'll see me. I have a smile on my face as I'm getting wrecked, on the mat. It's some of that I think is inherent. You come into the world with those kind of tendencies, but I still think that if you start those things as a child, it's going to be much easier. You will learn to love them. You'll learn to appreciate them. And you certainly learn to I really appreciate the results now.
Sure.
Because, in your 20s, you can get away with perhaps not putting in the effort and you can still look pretty good. But when you get into your 50s, I'm so grateful that I put the work in my 20s. I feel like I reached my peak muscle mass at about age 21 or 22.
Me too, yeah.
Yeah, and that was probably the best thing I could have done for myself, because it only gets harder. I haven't put on an ounce of muscle probably since I was 40. But what I've been able to do through good habits, good lifestyle, TRT, of course, is maintain that.
Maintain
it. My body weight, I went to the clinic yesterday, and I weigh the same as I did, 15 years ago for the most part.
Bro. How much you weigh again?
I was 107 kilos
Bro,
yesterday.
you're 107. And how tall? You're taller than me, I think.
I would love to say I'm 6 foot, but I'm just under.
Just
and
under.
actually, I've probably lost some because I had a lumbar fusion.
Okay.
So I lost some disc height. So I'm probably a solid 5'11".
107 kilos. The dude's lean.
Give or take.
At 52 coming up.
Yeah, coming up on 52.
Wow. So it's doable. And it's
doable.
TRT, guys. So we are not juicing.
Nope.
You know, I kind of like those compliments. I don't think I deserve them, but, you know, sometimes I get them in the hate comments.
Yeah.
Like, this face tattoo guy on steroids. I'm like, thank you, bro.
Yeah, thank you. Exactly.
But no.
Yeah.
For me, we're going to talk about that now. It's the TRT segue.
Okay, let's do it.
We know how to resolve diabetes, guys. All right. Lifestyle first.
It's so important.
Okay.
It is the key.
And this is coming from the doc, the emergency physician who prescribes meds when all else fails.
Yeah.
So if he is telling you that he doesn't want you to see him,
I want to be put out of business, honestly. And I say that jokingly, but it's not a joke.
It's not a joke.
I would love it if I never wrote another metformin prescription in my life.
You can do other stuff, bro. You can help with TRT prescriptions.
Exactly. Yeah, that's not going away.
That's not going away.
Yeah, that's only getting worse.
Yeah.
We'll talk about that.
Okay, TRT.
Yeah.
TRT.
Talk about it.
In the UAE.
Yeah.
All right. I'm in that space. I live in that world. But all of, if not 90% odd, come to me because they're ex-anabolic steroid users.
Yeah.
Now, I actually suspect a lot of this endocrine disruption from plastic bottles.
As we drink from the plastic bottles, right?
Alcohol. I actually suspect that, yes, it's a factor. I actually suspect the number one reason is actually anabolic steroid use. No one has said this, bro. Everyone in Australia is juicing. Everyone.
Yeah. Maybe here. That might be the case here.
Definitely. Bro, there's no one in my gym.
Yeah.
No man in my gym, not on gear, who looks good. And most of the guys that don't look good, 50% of them.
And they're still on gear.
Are on gear too.
Yeah. Yep. That's the same at my gym. Yeah. The guys with mediocre physiques. That quite honestly, they could have achieved naturally if they just took the time. I've gotten to know some of them. Oh, like 600 milligrams a test.
Yeah, I know.
You know?
Wow.
I'm like, why? Yeah, could you just be a little patient? You could have looked just as good with what you have naturally.
Yeah.
So, that is a big part of it.
I think it is
a big part of it. I will tell you though, in my practice back home in the US, like I got a lot of 22-year-olds who had never touched. They swore that they never touched an anabolic. Sometimes based off of their physiques, and their lifestyles. You know, they come in, you know, joking, not joking, but like covered in Cheeto dust, and they're like they're IT professionals, you know, addicted to video games. Like these guys have no intention of ever going into a gym or bodybuilding, and you know, they come in with like profoundly low testosterone. All of them are the skinny fat genotype, you know, that is the same genotype that's going to lead them to get type 2 diabetes. So it's, I think it depends, you know, you talk about groups within groups for sure. Like here, you're probably right. Like guys that have used PEDs and, I do get a fair number of guys that have used PEDs, you know, because you know, as you know, after a while, you kind of burn that bridge. And you're probably not going to get your own endogenous production back. At least not enough. No.
Didn't work for me.
No. It's rare. You can get some back, but it's like, is it going to be enough to keep you in peak health? And the answer for most guys is no.
Yep.
So you're kind of, I'm not, you know, if you want to use PEDs, it's totally up to you. You just got to know what you're signing up for, you know, which oftentimes is a lifetime of TRT. So if you're cool with that,
okay.
You're cool with that. Yeah, it's not so bad, right? It's not so bad. But you know, it does complicate your life. And that's something I say to my patients a lot. It's this is another thing that you now have to add to your to-do list. And when you travel, like you've moved here now to a new country. I moved here last year. It was yet another thing that I had to war game and figure out, okay, how am I gonna get my testosterone?
It's not that difficult
not
these
that
days.
difficult, no, but it's just one more thing.
One more thing.
You have to travel with it. You have to, you know, again, none of these things are like insurmountable things, but it is one more thing.
I agree.
It is one more thing. And if, you know, God forbid there's a supply shortage and you can't get your TRT, then you're going to suffer.
You're definitely dependent.
You are dependent.
You're dependent.
Yeah.
Okay. So TRT here in the UAE, here's my experience. I got here. There's obviously a lot of bodybuilders here. I asked them, no problem, bro. And I said, yeah, but I need a prescription.
Yeah.
And they're like, bro, no, none of us use that here.
No, you don't.
I said, for me, bro, I want a prescription because like, it's just for me. It's for my peace of mind. I'm sure that year is good, but I don't want to dabble there.
Exactly.
It wasn't that easy.
Yeah.
Not as easy as I thought.
I had the same experience.
There's a bit of a gap here for two reasons.
There is.
Now, the testosterone I have managed to get, it's Sustanon.
I know.
They only have in the UAE Sustanon and testosterone and decanoate.
Yep.
Now, just quickly, these esters are usually not the ones people in TRT want. They want SIPE or ENT because it's less esters and it's just, you know, in and out in a week.
Yeah.
And decanoate's like 10 weeks or whatever.
Yeah, and it's not that you can't make it work. It's just, it's not ideal.
It's not ideal.
It's not ideal. Yeah.
And we want to be ideal.
We want to be ideal.
And we're all used to ENT and SIPE.
That's what I'm used to.
Change.
I've never used anything else other than Cypionate.
Yeah. So although there may be compounding pharmacies that can do it for you, that's issue number one here in the UAE. There are not many, if any, dedicated TRT clinics.
Very few.
Very few.
They'll advertise TRT, but it's always like as an afterthought. It's a urologist visit that, you know, the BPH, erectile dysfunction, and whatever, prostate cancer.
Sure.
And, oh, by the way, if you want some testosterone. So that was my experience too. It was a bit difficult to find somebody to prescribe, and the knowledge level is not, let's say it's not as high as I would have wanted it to be. I don't know if you've found that as well.
I'll just say it openly. I don't think this is slander. I think that the scene for TRT here is just simply not as popular as it is in the States.
No, for sure. For sure.
Yeah.
The issue in the States, and I say this a lot, is access is not a problem. There are TRT mills on every corner of, you know, any medium-sized city and up. The problem in the US is quality, in terms of quality of the providers. So there's some good ones. And then, you know, I do multiple consults per week trying to, pardon my French, unfuck people's health problems that come from poor protocols. You know, I have guys that are like profoundly iron deficient because they are made to donate blood, you know, every 2 months for years. Guys that have crashed their estrogen. So, you know, that's something I hope to help correct maybe over the next few years. But there's not an access problem, but there's a knowledge gap problem. And so the quality of care, you kind of roll the dice in the US. I feel like here there's a bit of an access problem, and there's also a bit of a knowledge gap problem as well. So
a bit.
I'm trying to be nice.
There's a huge knowledge gap.
Bro,
you're coming here to help. So the way I see it, and the way my Emirati friends will see it, you are coming here as an expert from the West to show them something that has been done in the West successfully for a long time to help. We're talking about objectively helping people live longer and better.
Exactly.
They're not backwards people here. They want to know.
No.
So you can talk completely openly here about what it is that you would change. Do you have any plans on anything specific here in the UAE?
Yeah, this is my new home. I mean, this is just like yourself. Now, you know, I will obviously still travel, and you know, my wife and I love to travel, but this is going to be our home base. And so, you know, wherever I am, I want to make things better, you know, for people just in general. That's just the nature of my personality. So this is an area that I think, I can probably help a lot of people here. So as I eventually transition out of my emergency medicine career, this is what I'll be transitioning into. So it's going to be, it's not just TRT though for me. Like TRT is just one facet of health and longevity in men. Like it is, it's you know, you can do TRT perfectly and still die at age 60 from an MI, you know, and with a good set of abs. But, you know, have I really done my job if that's what happens to you? No. So I like to take a little bit more of an in-depth and a little bit more of a holistic look. And TRT is a huge part of treating a bunch of other chronic medical conditions. You know, people don't realize, you know, how prevalent low T is in type 2 diabetics. We'll circle back to diabetes. You know, up to 50% of type 2 diabetics are hypogonadal by the strict, you know, Endocrine Society guidelines, which are incredibly strict. And if you loosen up those guidelines, I mean, I'm going to go out on a limb and say there's probably 99% of type 2 diabetics would benefit from testosterone in one way or the other. But if they don't meet strict criteria, they often are not prescribed that, you know, and they just get yet another diabetes medication. Oh, try this GLP-1. Let's up your metformin dose. Oh, I'm sorry, we have to put you on insulin. How about testosterone?
Yep.
How about it? You know, and that's, I want to have all the tools. You know, I want to have the traditional medications, but you know, there's use cases for TRT here, and I think that would help a lot of these. You know, not just the Emirati people, but the expat community as well.
Sure.
A lot of, you know, I don't routinely test testosterone levels in my emergency medicine practice. I know they're low.
You know
I can
they're
just
low.
tell. You just have been doing this long enough. I know they're low, and I know the guys. I can spot them that would benefit from it.
Excellent.
So
I'll translate to the lay audience. What he's saying is that TRT is not only to get muscles and to keep your libido up.
No.
He's talking about helping with diabetes directly. There is a direct relationship. And it's all the other things like your bones, your blood,
exactly,
your brain, your mood,
exactly,
sleep.
That's what I care about.
That's what he cares about.
That's what I care about. The cosmetic stuff, you know, the muscles and whatnot. First of all, if you don't do the other stuff correctly, you're not going to get the muscles, right? You're not, I don't care what your testosterone level is. You can take 600 milligrams a week. If you sit on the couch, you're not going to get the benefits. So, you know, you get muscles proportionate to the effort and the discipline that you put in, combined, of course, with your genetics. But I look at, you know, the six pack is a side effect of the overall improvements in health that you'll get by normalizing your hormone levels, including testosterone, and doing the diet and lifestyle stuff. I think of them as three gears that just turn each other, you know, the nutrition, the training, and the hormonal optimization. And it's, I'm sure you've seen it too. It's amazing. If you can get all three of those gears turning at the same time, those are the guys that drop 50 kilos in 9 months.
Yep.
You know, and they come off of all of their prescription drugs.
Yep.
And those guys, like that, nothing makes me feel better than seeing that.
These are the guys
Totally
that are going to come
possible.
and see you.
I hope so.
I know
hope
so.
so.
They're in my inbox already.
I hope so.
And I'm kind of vetting people because the sort of men I'd like to send to you are what's called coachable athletes, as
They
I call
have to
them.
be coachable.
Because, bro, I know there's people in my inbox, the sorts of questions I want to say, it's not happening for you, bro, right now.
No.
But the guys that are actually enjoying this process, that want to do it all, they'll get it. And I honestly do feel like there are some people, you can't help everyone.
No.
You've got to select who you think are more helpable.
Exactly.
You're only one man, bro.
Yeah, I know.
You know what I mean?
They have to, you know, you're completely correct. When I was doing full-time primary care, the vast majority of my type 2 diabetic patients, even though I did everything I could to help them, they got worse every single year.
Worse.
Every year. Just the scale kept going up. Hemoglobin A1C, I could keep it under control a little bit, but just by adding more drugs. And I would talk till I was blue in the face, you know, about nutrition and training. I didn't know that much about hormones back then, but it wouldn't have made a difference, you know. So yeah, it does come down to the individual. Like you've got to put in, you have to be invested in it. And then you just need the expertise at that point, you know. But the hardest part is making the decision and just becoming invested in the change, you know.
Yeah.
And then you just seek out the expert care.
AKA. So this is your livelihood. You've got to feed your sons and your
That's
wife.
right.
And so
I've got two boys.
So there's a reputational risk. If he doesn't get results for clients,
that's right.
It's not going to be a very successful clinic.
Yeah.
So I really do think there will be some sort of selection criteria that you'll have, because some people, unfortunately, bro, they are addicted to the complaining. They almost enjoy this therapy session and then do nothing about it.
Exactly.
They pay you to be a therapist.
Hobbyists, you know,
they're
like
hobbyists.
there's a lot of guys out there that you see them on the forums, and I've had a few of them, you know, approach me for my practice that, they're the guys that they always want to tweak their protocol. What if we do this? Can I add a little CJC and, you know, whatever, you know, and then, or they'll come to me already on 75 different peptides and all these other things. And then I ask them, like, write down everything you eat for a day. And it's like crickets, you know. They're just really into the
drugs.
They're into the drugs, and it's entertaining for them. It's a hobby. It's a hobby. So
knowledge junkie.
They're knowledge junkies.
They know so much.
Yeah. They're the guys that spend, you know, the analogy is like they spend $1,000 on the best suntan oil ever made to get a tan, and then they go out at midnight and they wonder why they're not getting a tan.
Yeah.
Right.
Perfect analogy.
Exactly. Yeah. I stole that from Mike Menser.
I like that. Okay. So none of those guys, you'll probably have a bricks and mortar clinic here, or?
So I think that's what works the best here, but really, telemedicine is growing all over the world. So there needs to be a telemedicine component. at least for just for the convenience aspect, and maybe for established patients, maybe for these first few months we work together, you see me in person, and then as you become a more established and more chronic patient, we can, I can save you some time, and we can maybe do things via telemedicine.
Sure.
So, the exact details can be worked out.
Okay.
But I think there's a lot of benefit to having a brick and mortar facility, because sometimes there's some in-person testing, and there's things I can tell about a person sitting across the room from them that I can't pick up on necessarily, across a computer screen.
Just quick fire, a minute. What sort of things?
I can basically, like, it's just silly stuff. Like, I can look at your neck veins a little bit better, and see.
What's
like,
my neck vein?
Your neck veins are fine.
They're fine?
They're fine. Yeah. Guys that have heart failure will have, big neck veins, that sort of stuff. There's just subtle mannerisms and things like that. I can also get a better idea of, like, your physique.
What's mine like in person?
Yeah, it's incredible.
I'm jacked.
You're totally jacked, bro. You're totally jacked. You're definitely on TRT.
Yeah, definitely on TRT.
Yeah.
Okay. Yep.
But yeah, and then there's also just, like, it's easier to build rapport in person. But on top of that, like, I think it's really important to do some ancillary testing. And what I mean by that is, bedside ultrasound. Let's look at your heart. I can't do that over the computer. Let's look at your carotid arteries. Look at the ultrasound out, and we'll measure, the plaque that you've built up in your arteries. Let's do a VO2 max. Well, I've got to do that in the office, on a machine. So having those kinds of things, if having a DEXA machine is great if you can afford the $100,000, to get a good DEXA machine. So in person, I think, can be really useful.
Yeah,
but
we need all that, bro.
We need all that stuff. Yeah,
all of
because
that.
It's actionable information. It's really actionable. I can tell, as you're losing weight, if we just throw you in the DEXA over time, are you losing muscle mass as I put you on a GLP-1. Let's make sure we've got you on a good protocol, and I can tell down to the ounce. Am I keeping your muscle tissue intact, which is, like, one of the most important things when you're on, a drug like that. I need data for that. I need a DEXA machine.
Okay. Let me sell the dream, and then I want you to speak to other physicians.
Sell the dream.
Other expat physicians.
Sure.
That's going to be the next question. So let that simmer.
Okay.
I'm going to sell the dream. So this is a dream. The expat, he wants to get fully tested, top to bottom.
Yeah.
He walks into your office. Maybe there's also a little gym there. And you're going to, run bloods. You're going to do VO2 max tests on the treadmill, see how fit he is, echocardio. You're going to test everything in one center, because he's a, busy gentleman. He doesn't want to go to all these different clinics, all these referrals.
Yeah.
And you're going to do everything from that single location. However, what's the regulatory environment like to get this stuff as an expat physician? How easy or difficult is this?
Good question. Like, that's an unanswered question for me. It doesn't seem like it would be that difficult here. In fact, my gut feeling is it's probably easier here than it is in Australia or the US, because there's just,
definitely Australia, bro.
Definitely Australia. Yeah. The laws here, as you know, like, they're geared towards people who want to open business. Like, they're there to help you, as opposed to take a piece of the pie, which is in Australia and in the US. So, I haven't gotten that far to see, what the regulations are with something like that. But it's, let's put it this way. If they can do that in the US or Australia in that environment, bro, you can do it here. Yeah. You can do it here for sure.
Absolutely.
So that guy, that 50-year-old executive, that, maybe flies in from somewhere else, from Australia. Yeah, that's actually kind of what I have in mind, is spending an entire day with that guy. That would be my dream. You do all the testing in the morning, you give him a nice lunch, and then you sit down in the afternoon and you go over all the data, and then you come up with a plan. And he flies home or drives home, whatever, with an actionable plan and a lot of information that he didn't have before.
That is the best $10,000 that man ever spends. You spend a day with Dr. Andrew Winge, and you go home with a piece of paper that says, shit, I was about to die. Now I'm probably not.
Hopefully not.
Literally, because if you test someone top to bottom, what I found, seek and you will find.
Oh, yeah.
You'll always find something.
There's always something.
Always.
I mean, there's always room to improve.
Yeah.
There's always room to improve. So, but that's, if you want to talk about, like, the Cadillac of, age management medicine, that's one-on-one with a physician and their team, because you'd have to have a team. You have a physiologist and a nutritionist and people that help, and you have a solid 8-hour day, 4 hours in the morning, 4 hours in the afternoon, and just go over with a fine-tooth comb everything.
Yeah.
And
I mean,
I enjoy that.
that
Actually,
would be incredible.
it's totally
bro.
good.
Totally needed. I mean, Dubai, Abu Dhabi is the place for it. People have the wealth. They want to spend for that sort of like all-in-one stop shop service.
Yeah. And if and again, think of the value. Say $10,000. People say that's a lot of money, but if in the course of that evaluation you find out, oh, you have a 90% blockage that next month could have killed you.
Yeah.
Which I have found, and people on CT scans. Yeah. CT angiograms, people who are asymptomatic, put a value on that. Sometimes you find things that are pretty serious.
That's cheap, bro.
Yeah. That's cheap.
This is not a lean.
It's totally cheap.
There's
it's totally cheap.
It's cheap.
Exactly. Exactly.
That's kind of what I was thinking. I was in the ballpark of. I know Peter Attia has one of these centers.
He does something similar to that, I think. Yeah. And there's places in the States that they have kind of a similar executive, sort of paradigm like that. But there's value to that.
There is.
Yeah. Yeah. And, some of them sell a little bit. There's a little bit of quackery involved. There's a little nutritional supplements and things like that, which, I probably wouldn't get involved in anything like that. But the meat and potatoes of it is the diagnostic testing and the lab work, and some of the bedside tests that I would do. You can get that's really good information to have.
No, some of it's not ethical, and I would.
I don't care for it
either.
Yeah.
I don't think it's going to last as well, because when you try and scam people without very objective results, it's fad.
Exactly. Well, you're constantly counting on like the turnover, because people are not going to come back to you. If I sell you this $200 bottle of ashwagandha, or whatever, which some clinics do, they're going to see you as a fraud. That's one thing for me. Like keeping my reputation intact is like extremely important.
Of course.
Without your reputation, what do you have?
You're done.
You're done. So, you have to do things 10 out of 10 ethically, for people. And if you show that you care about them, genuinely, I'm hard on my guys, like I have high standards for them, but, all of them will tell you that I care about them. I text them, all the time. How are you doing?
He's a true empath. I know that because we speak on Instagram all the time.
Yeah.
Admittedly,
I
more than me.
That way,
no, you do. Look at me. I'm quite robotic at times, unfortunately.
I am too. We're the same personality type.
Very similar.
Very similar, yeah.
But you have a way where you are, because you're a physician, you're a professional, you consciously take the time to like say those words, something that I'm not getting good at, because we're all patients, all right?
Yeah.
We're paranoid. What's gonna happen to me, bro?
Right.
When you just say that one sentence and we just my anxiety is gone. That's so important for a physician not to be that dry.
For sure. And I learned that in emergency medicine, because a lot of emergency medicine visits are related to anxiety. They're not necessarily serious problems, but the person is worried that it's a serious problem. So there's an art, and as you go through your training and you practice for a long period of time, you learn how to sort of talk people back off the ledge, reassure them. But sometimes it's not a deadly problem, but it is a serious problem, and so you don't want them to blow it off, but you also don't want to catastrophize and then give them another panic attack about it. And so you have to kind of navigate that. Like, look, you're going to be fine, but please don't blow this off. Please get these tests. Let me help you make an appointment with your doctor so that you can get this checked out. It's not an emergency tonight, but if you don't do something about it, it could be an emergency in 6 months. And let's not let it get to that point. So, there's an art to giving bad news, and there's an art to talking to patients. And admittedly, I was pretty shitty at it, as a med student. But 25 years later, you get better. I'm not saying I'm that great at it still, but you get better.
Humble this guy.
No, you get better at it. Trust me, I've fumbled many patient conversations, especially at 3 a.m. when I'm tired.
Wow, bro.
But I mean, again, if people can tell if you're genuine,
they can.
Like if you don't care, they can tell that you don't care.
Yeah.
But if you do care, people pick up on that.
Yeah.
People can tell.
You know
So,
why I asked that question? Because we're heading into behavior now. Okay.
Yeah.
And the psychology.
Yeah.
And the reason
That's
is
the key.
it's the key. It's the key. Okay.
It is the key. Yeah.
So you are what? You're 17 years older than me. People are going to think we're the same age.
Could be your
like
father.
I said, does it say that I look old or you look young?
Yeah. I don't know. Yeah.
You know what I mean? All right. So I see you as how I'd like to be refined as I get
I'm flattered.
older.
Yeah.
Okay. I'm less erratic than I was when I was 7.
Yeah.
And then at 15, I'm less erratic at 7. So I feel like this progression, I'll get there, right?
Yeah. Yeah.
And obviously you've been deployed to war.
Yeah.
Okay?
Twice. I did
twice.
two Iraq deployments.
2 Iraq deployments.
In the U.S. military.
Legit. So we just leave that one there, all right? And then you're an emergency physician. You literally see people come in after car accidents, legs are off, okay?
Yeah.
This is about as high stakes as it gets, yet you seem to be the most chilled, gentle dude, even though you are legitimately lethal, all right, from hand-to-hand combat as well as, with these ones. We're here in the UAE. I got to ask this question. I have to ask everyone this question, bro. From the USA, I'm from Australia. I've been in Europe. It's chaos in a lot of those places over there. I don't think anyone's debating that.
No.
It's so safe here.
It's beautiful.
It's like you forget
amazing.
what danger is.
Exactly.
Have you noticed that?
Yeah.
You're like, what? Well,
I've already gotten to the habit. I don't lock my car.
Yeah.
Which I never in the United States, man. I not only did I lock the car, but I made sure if there's anything that even was
exposed,
remotely valuable, it was underneath the seat. I have a laptop that goes under the seat.
Yeah.
I could open my laptop and put it on the hood of my car and walk away and come back 8 hours later. It would still be there.
Yeah, bro.
Or more likely, someone would come and find me and be like, "Sir, you left your laptop."
Yeah.
Yeah, it's amazing.
100%.
It's a big part of why we're here.
You've got 2 sons.
Yep.
I've got a daughter.
Yeah.
They're both very young. They're going to be growing up here.
Mm-hmm.
This is a question. You don't need to put this one on air.
Okay.
But it's I'm playing a game.
Yeah.
The game of preference. You can't choose in between.
Okay. You have to choose.
It's just a game.
Okay.
All right.
Fair enough.
You let's say you have a daughter next.
Mm-hmm.
Your daughter either grows up, all right, under like Muslim household. She's covered up with a hijab, or she's there in the USA where it's completely normalized to have friends that have OnlyFans and, take photos in bikinis. Which one? Go.
Oh, God. Muslim, easy.
Okay.
Easy.
Boom.
Yeah.
All right.
Yeah.
You know why I asked that?
And it's not like I'm 100%, one way or the other, because, I am not a religious person, and I don't like orthodoxy very much in things, because I do believe that, life, are shades of gray. Now there are absolutes, but there are also shades of gray. So, but yeah, if I had to choose, and this is the game,
That's the game.
there's no in between.
Yeah.
I would probably choose something in between that leans heavily towards that Islamic side, but you're making me choose. So that's an easy one.
Okay.
That's an easy one. I know she'll grow up with good family values.
Yep.
Okay. I know that she'll be respectful. I know that she's not going to get involved in drugs, alcohol, crime. I know that, the odds of all these negative things that I see in the United States, she will not be in the emergency department with a heroin overdose, which is, again, what I used to see all the time.
Very sad.
So, it's terrible, or a fatal fentanyl overdose. So I lost many patients to fentanyl. I know that's not going to happen in that box. So I choose that box every day.
Yep.
Yeah.
And I think most fathers would agree. And I think the fathers that would disagree, I probably wouldn't get along with them.
Yeah.
Okay.
Yeah. We just see the world differently.
Okay.
Yeah.
So it's a game of preference. And what that says to me is that there's this continuum. This is full OnlyFans spec. And then this is fully covered.
Fair enough.
Fully
covered all day, every day.
So you're way more over on this continuum. And then I start to reverse engineer. I say, okay, if you don't need to be full covered, which a lot of Muslim girls don't. There's moderate and there's different, right?
Exactly. Yeah.
What else, if we exclude that and exclude the ritualistic side, do you not want your daughter to do in the Muslim religion? Because I couldn't think of a single thing.
I really like bacon.
Okay. But that's it.
Like literally, that's it. Yeah. Honestly, like I like pork.
Okay, well, there you go. That's so American of you.
All right. But I'll tell you, I've been eating nothing but beef bacon since I've been here, and I'm getting a taste for beef bacon, so I can give that up.
For me, it's
can give
better.
yeah.
It's more nutritionally dense.
I think so. I
For
think you're
100
right.
grams.
Yeah.
That's why.
That's so good. That's
Very
so
good.
It's so good. But yeah, no, the family values we were, before we recorded, I was joking, like I felt like I was half Muslim anyway,
Yeah.
you know, just because I grew up in a very well-ordered, functional, good family. Everybody loved each other. And, you know, I feel like that's I appreciate family values.
Big time.
So I went to medical school where 25% of my medical school class were Mormons. So that's another demographic.
Wow.
Mormons are very heavily, you know, they put family first. You see that in the communities here. You see that with the Muslim community as well. I appreciate that a lot. And I feel like we used to have that in the West. Here we've lost it.
We've lost it.
Yeah. So the Muslim values used to be universal values.
They did.
And they have eroded significantly in the West. And that's a shame, you know, and because there's fallout from that. That's all these other societal problems. If you break up the family unit, you know, that is the core of society. And that's, but it's also potentially the weakest link, because if you can break the family unit, now you can do anything. You know, everything's just wide open. You know,
that's why we're here.
That's why we're here.
That's why we're here, right?
Yeah, exactly.
You know, it's so interesting when you say Mormons and how the West used to be like that. One of the most common questions I get, or comments, is that you don't need Islam to do that. Well, I'm not Islamic. You're not. We can.
Yeah.
Okay. We can. But what I've noticed as a whole, as a society as a whole, when there's no actual enforced restrictions on how you should behave, there's going to be that 20%, even less.
Always.
And that is too much. For example, how many mass shooters do you need to kill 100 people?
Exactly.
One.
Exactly.
Okay.
Exactly.
It's not like out of 100 girls, 20 of them are OnlyFans girls. It's that there's maybe one, and then that leads to the influence in the other. And it just, the minority is too much.
Exactly.
Yeah.
Yeah. There has to be some standards that say something this is not acceptable.
Non-negotiable.
For anyone.
Anyone.
And
ever.
If you're going to do that, it's not going to be here.
Yes.
And I greatly appreciate that.
So do I.
Yeah.
Are there sacrifices that potentially come from having very strict rules? Yeah, maybe.
Of course.
But it's preference.
Of course.
Yeah, that's why we're playing this game.
Exactly.
And I've been reading the Quran. Obviously, it's not the perfect translation because you need to know Arabic.
Precisely.
You have to,
precisely.
right?
Yeah.
But just from a pragmatic point of view, I've been reading it. I think a lot of people think I've converted. I haven't. You know me.
I know you, yeah.
I love studying behavior.
Exactly.
Because behavior translates into successful economies. I love business. You ain't going to do good business in Venezuela.
No.
And that starts with how chaotic society is.
Yeah.
Okay.
But the Quran tells you how to run a business.
Exactly. Ethically.
Exactly.
It's incredible, right? You know more than I thought you knew.
Yeah, I've got it at home.
Okay, see, with pragmatic dudes that come here, like they've all at least got like a little handle on it.
Yeah,
because they're like, why?
Yeah. I'm not a scholar or an expert, but I know enough.
You know enough.
Yeah.
All right, that's really cool.
Yeah.
Preferably speaking, we would prefer a full-blown Islamic community than we would like full-blown chaotic West. All right, but there's shades of gray and no bacon. It's you don't like that one.
Yeah.
Okay?
I can live without it.
You can live without it.
I can live without it.
Yeah. You know why they do that? Do you know the reason?
I don't know the exact reason, but I've hypothesized it has to do from, pre-industrial times. There's a high parasite burden in pork. And so it's the same in Judaism. You're not supposed to eat pork.
Not the reason why.
Not the reason. Okay. What's the reason?
Way simpler, better reason.
What is it?
Submission. Purely because he said so.
Oh. That's it. Okay.
Yep. So even though the swine there was kind of like that sort of plays into the reason.
Yeah.
The real reason is the fact that because he said so, and what that does, that submission, it just brings things in order.
Yeah, that's the way it is.
Yes.
Yeah, that's the way it is.
You know,
There's something to be said for that.
Is it something to do? Of course.
Yeah, of course.
You're a doctor.
Yeah.
When your patient asks you 100 different questions and they're about to die, just listen to me, patient.
Right.
You must love that.
Right. Yeah. I don't say that very often, but sometimes I have to.
Yeah.
Just shh.
Yes. Yes.
Let me do my job.
There you go, right?
Yeah.
When you're building a company and you're a CEO, you only have a few minutes each person.
Yeah.
Don't ask me every little question why.
Yeah.
I took 10 years to explain this to you.
Yeah.
Yeah.
See, I immediately gravitated towards a medical explanation, right? Because,
I did too.
there's always a logical medical reason, but no, because.
I thought that too, because you know why?
Yeah.
That's what the boys in Sydney would educate me, the Islamic boys.
Yeah.
So that comes into segue this topic right now.
Yeah.
It happens in the US, but less. It's UK, France, EU, Australia. I'm just going to go out on a whim and say it. If I can't go back to Australia and I'm going to get hurt for it, so be it. Bro, the Islamic gangs run shit. I know.
You've told me about it. Yeah.
They run shit.
Organized crime.
Yeah, bro.
Yeah.
So when you see patients in the US for shootings, a lot of this comes from Latin American gangs,
exactly,
and then African American gangs. Am I allowed to say that these days?
95%. Yeah.
There you go. You can. Can you say that? You can just say that.
Well, facts are facts.
Facts
right?
are facts.
Facts are facts.
Okay.
Yeah.
So there are clear distinctions on which races and demographics are committing these crimes.
Yeah.
And in Australia, in the West, the drug dealing and the gang, you don't mess with the Islamic gangs.
Right.
Don't try.
Right.
Okay. And the majority of these shootings are actually one Islamic family to another. It's like Muslim on Muslim.
Family feud.
Family feuds.
Yeah.
Okay. Obviously, it has nothing to do with the religion per se.
Yeah.
It's just that's been attached, that identity,
Exactly.
right? So you can imagine the reason it took me so long to come here is because that's my recency bias of Muslims.
Yeah.
So I was like, bro, I'm not going to live in those countries.
Right.
So when I come here, I got a huge shock.
Yeah.
Huge. The Emiratis are absolute gentlemen.
Amazing.
They're amazing.
Absolutely. Sophisticated gentlemen.
Yes.
Yeah, absolutely.
Yes.
Yeah. Almost without exception.
Without, I haven't met a bad one, bro.
No.
They're like all the same.
No. They're super well-spoken, highly educated, worldly, and friendly.
Yeah.
Like super friendly.
How good's their English?
It's not bad. Yeah. I mean, it depends.
It depends.
It varies, but in general, like I occasionally have to use a translator.
Really?
At the hospital.
Maybe in Abu Dhabi. Dubai is obviously a different breed.
It's probably different in Dubai. Yeah, it's probably different in Dubai. But it's, it's not always. And sometimes they're embarrassed because they don't think their English is good enough. And I'm like, no, trust me, your English is great.
Yeah.
Like we can communicate. We don't need a translator.
Absolutely.
Yeah.
What I've found is that the Emirati gents, it's so much easier for me to get along with these blokes.
Yeah, me too.
Do you know?
Yeah.
They have humor. Do you know? Like you just got to. These are conversations that you have when you're comfortable enough with them. They're like, for me, one of the boys. Whereas in Australia, bro, I was self-censoring anywhere I went with this wokeness.
Oh, for sure.
Oh.
It's the same in the U.S.
It's bad there.
You want to crack a joke, but you're like, I probably shouldn't say that.
You can't say
here
anything.
you probably can say it.
Well, you can. Do you know what I mean?
Yeah.
So this is what I wanted to ask you, right? You got deployed twice in Iraq, right?
Yep.
You okay to talk about this stuff?
Of course.
Briefly.
Yeah, of course.
And you're against Islamic regimes there. Yeah.
I mean, I'm against them.
No, when you were there, sorry, I'll put it wordly. When you went there for the USA, you're against Islamic regimes. That's
It was the
who was
the
it then?
insurgency was the main antagonist. So there was the Iraqi government that they were trying to prop up, and it wasn't doing very well, especially the first time. I was there at first, just right after Fallujah, so things were a little bit crazy. And so there was mainly the ISIS insurgency and other groups as well that wanted the U.S. out of there.
They wanted the U.S. out of there.
Yeah, and rightfully so.
Okay,
rightfully so.
Now, do you know? Okay, let's two questions. First of all, do you know these groups, ISIS and that you were fighting against? Do you know what exactly they interpreted in the teachings for them to act that way? Because they were very religious, right? What is it that they misinterpret? What parts of the book do you know?
Good, I don't know. I would have loved to be able to sit down and talk with one of them.
Yeah.
But my interactions with them, they were usually blown to pieces, and I was trying to patch them together because we took care of them, just like everybody else. So I didn't have interactions with them, and so the rare times that I did, it was a strictly a medical, sort of a situation in there. But, I was told a certain story before I arrived in Iraq, and I left Iraq realizing that story's bullshit.
Bullshit.
You know, it's not true. There's a lot of untruth. You know, there's a lot more to the story, I should say.
Yeah.
You know, to that. So I didn't feel good. I have very mixed feelings about my deployments. Very mixed feelings about it because I felt good about my role there. I was there to help people.
You were
know?
saving their lives as well.
Yeah,
which
so
is incredible.
Civilians, military, Iraqi police, like it didn't matter which side you were on. You know, the Geneva Convention is the Geneva Convention. I didn't treat anybody differently, whether they were so-called enemy combatant or not. And I felt good about what my job as a doctor was. I felt bad about the fact that I was a tiny cog in a wheel of a illegal war that was based off of lies. You know, Saddam Hussein has chemical weapons and weapons of mass destruction and all of this stuff, which was so obviously a lie.
Bullshit.
It was complete bullshit. It was complete. Even then, it was pretty clear it was bullshit. And now, of course, you know, decades later, it obviously was bullshit. So, you know, I don't feel good about that part of my deployment there, but the day-to-day stuff, you know, I felt I never was involved in anything that I was not proud of.
Yeah,
you know?
sure.
So,
I mean, you must sleep pretty well
doctor,
at night knowing you saved everyone. That's incredible.
Well,
bro.
I didn't save everyone. That's
that's
when I don't sleep.
Yeah,
the ones I couldn't save. But yeah, you know, you roll there. I wasn't there as a combatant. You know, I wasn't kicking down doors and interrogating people and you know, throwing people in the back of pickup trucks like some of my buddies were.
You don't know what you don't know at the time.
You don't know what you don't know. Yeah. So I was you know, I was there to help people, honestly. And so from that part of things, it was a really good experience. Like it was like the peak of my profession, you know, taking care of like the craziest stuff you can possibly imagine. So that was like it was intellectually very stimulating, but at the same time, it was fucking tragic. Like, you know, war is not a joke. It's, you know, you're taking care of innocent people,
children.
I mean, I won't tell you the stories, but enough that like they still bother me with the kids. Yeah. Because you know, it's always even with this stuff that's going on right now with Iran and Israel, you know, the people that are getting killed are innocent on both sides. Yeah. They're not combatants for the most part. So dealing with that every single day, you know, little girls with, you know, gunshot wound to the head, you know, she's 8 years old,
Man.
You know, and just caught just in the wrong place at the wrong time.
That's
crazy. You know, bomb goes off, you know, boom. Oh, it happened to be next to a school.
Yeah.
All right. You know, like that. Yeah. So I have a lot of respect for like war. Americans especially think it's a video game, because all we see is these drone videos and things like that. It's like, no. This is not a video game. This is real life, you know? And until you get put into a situation like that and you get to see the end result of it, you know, I don't think people truly appreciate that. We had a visit from, I can probably say this now, but Rumsfeld was there. He was, you know, one of the architects of that war, and he came to, you know, pin some medals on people. And it was after one of my shifts where I had taken care of, you know, a bunch of kids and women and stuff like that who were wounded. And I just turned around and walked out. Like, I was just like, I can't be in the same room with this man, you know, who is smiling in his pinstripe suit, you know, who is like directly responsible for the shit that I just took care of the last 12 hours. So I had a very bad taste in my mouth, you know.
Fair enough.
Looking at the whole as a whole, again, the individual stuff day to day, you know, you feel good about that kind of stuff. But yeah, I'm not a pacifist by any means, but I'm very anti-war, you know, because of my experiences over there.
I'm super anti-war, bro.
Super anti-war.
That's why I speak about Bitcoin. People go, what? Bitcoin war?
Yeah.
Did I raise that to your attention?
You did, yeah. Okay. And you're 100% correct.
It's objective fact.
Hard to finance wars.
Yep.
When everybody uses Bitcoin.
Yep.
So that's the way, you know, that's maybe the way that things get solved.
It's the only way. You have to cut it at the finance.
Exactly. Yeah.
I'll tell people quickly within a minute or less.
Yeah, let's hear it. Because this is good. This is gold.
Okay.
We'll do a short on this.
All right, we'll do a short on this. I've done many of them though. Yeah. So I've rehearsed this one or two times.
The more the better.
All right. In order to finance a war, you need the money. The US prints the money.
Mm-hmm.
They buy the weapons.
Yep.
They can go to war. It's very simple.
Yep.
As soon as you cut off the US dollar's control, which you can do with Bitcoin, there'll be less money for weapons, less wars. Very simple concept.
It's a simple equation.
Okay. Now, there's some nuance behind it. Like, for example, other countries, their currency is based around the US dollar. So they can't print unless the US prints, unless they want their currency to lose trust. So everything is revolved around the US. Doesn't matter who. Here, we got the peg in the UAE, all right, which is ironic. And then you've got Japan. Everyone is based around this. Now, not everyone's conscious of this. I should say that just because I'm using US dollars doesn't make me, pro-war.
Exactly.
It's just that every dollar you can, which is not always convenient, you use Bitcoin or hold Bitcoin, and it's $1 away. That's all.
It's just your little tiny contribution.
Yeah.
That's how I look at it too.
That's how I see it. You know what I mean?
Absolutely.
So it's good. It feels good, Yeah.
Stick it to the man.
So here in the UAE, TRT, it's a less popular thing. What would you change exactly?
Well, just because it's less popular doesn't mean it's not needed. That's for sure. Like we alluded to earlier, the need here, I think, is quite great. It's quite great. And I think the UAE as a whole would absolutely benefit in terms of all of the medical issues that we talked about already. So, I would like to see more availability. So there needs to be clinics that don't just do TRT as an ancillary service, but really should be one of the core things that these clinics offer. The other part of that, and this is something that I've been mulling around how to approach for quite some time, is, how do we level up providers here? And I would say providers because I come from the US where we have physician assistants and nurse practitioners, but here it's just doctors, GPs, specialists, and consultants. So it's a little bit of I've had to learn the system here. But how do we educate them? How do we give them the information that they need to do this at the highest level? And so, I'm interested not only in seeing patients here, but quite frankly, setting up some kind of a system where we can educate doctors. And I would love to get a hold of them in medical school, just like, getting hold of the pre-diabetic as a child. I'd love to get a hold of these doctors as medical students and then introduce these topics to them, even in the early parts of their training. Now, that's not always going to be possible, of course. Because
you need to be a professor?
Well, if I taught at a medical school, I would need to be a professor. But, there's the way the world is today with online learning and educational courses and things like that. I don't think it would be that difficult. And this is something that I have been chipping away at privately at home now for over a year, is putting together, something that's going to be like a 1 to 2 week really in-depth course on how to do this stuff properly, what to look for, what are the pitfalls, how do you pick who's a good candidate, all of these things that are like fundamentally important, and offer that to physicians, who want to get into this space. Because, if I were to open up a clinic here, I don't necessarily it's a bit self-serving. I don't want to be grinding it out every day, seeing 30 patients a day. I want to bring in other doctors to build the clinic. Well, they need to be trained, and then we bring in more and they need to be trained as well to my standard, which I feel is pretty high. And so how do they get to that standard? If they don't have a proper background in it, you have to put them through some sort of a training system.
That's excellent.
Yeah, that needs to happen. That's actually something I'm extremely passionate about. I love taking care of patients, but at this point in my career, as I get into my 50s, like I'm trying to think bigger. When I step away, and retire, I would like to have a huge team of physicians who are all trained up to the highest standards, who can like take it from there, and just go forth, and do things well.
That's excellent. So it's basically a B2B course for other physicians.
Yeah.
Now, obviously, the biggest firewall for people with good ideas is access to the right contacts and then access to capital. So let's talk about access to contacts.
Yeah.
Let's say I could put you in touch with the guy. Okay. What would you tell him? The guy that can approve it here in the UAE as far as regulatory compliance goes. How would you sell this concept to him?
Yeah, I think the best way to sell it is you can approach it from a cost saving standpoint. I mean, government bureaucrats love, when you start talking about money and cost savings in healthcare, imagine imagine how expensive it is to take care of a type 2 diabetic for 30 years with multiple hospitalizations, including bypass surgeries. Dialysis is insanely expensive. All of that money could be potentially saved and put back into the system and used other places, maybe where it's needed even more. So that's the way to, I think, approach it, like on a governmental and administrative level. The other thing is just improving the quality of life of the UAE citizens. I mean, that's one thing about the government here. I get the impression, I think you do too, the people that run this country, they actually care about the citizens.
Big time.
Big time. And you don't get that feeling. I didn't get that feeling in the US. Politicians care about being reelected, and lining their own pockets. Here, I get the impression that the people that are in charge of this country, they genuinely care, like they're true patriots. They want what's best for the people of the UAE, not just now, not just 5 years down the road, but they have like 50-year visions. Nobody in Australia and the US has a vision that goes 50 years. They have that here. So this is something that is, it's a tiny, tiny, tiny part of that, but having good access to good care in this realm, like, is good for the country. It spills over into, do you want a whole generation of low T men, inheriting your country, or do you want a generation of healthy, strong, vibrant men with healthy testosterone levels, free of chronic disease, running your country? Those men, I would choose. Those men are much more likely to do a good job governing the country than the diabetic, overweight guy dependent on pharmaceuticals who's tired all the time and lethargic.
Absolutely.
So.
Well, you're right about everything there, but I'm going to go a little bit deeper and explain to the audience the differences. So here in the UAE, you have rulers, okay? So regardless of whether you want them there or not, they'll be there, which I love because it gives them time to relax and make long-term decisions because their sons or their heirs will inherit.
Exactly.
So they're planning for 50 years.
Exactly.
Whereas in the US or Australia, these democracies, they got to win an election, get what they can for 4 years, and then they bounce.
Yep.
So they're constantly kicking the can down the road.
Exactly.
So yes, they absolutely care about their citizens because they're going to be in power regardless.
Exactly.
So what they do here, really comes from the heart. They care, they reinvest in the citizens. So like, let's say, okay, one of the top Gs, he hears you. Somehow you get a seat at the table. You got all this stuff. You got this awesome business plan, which I know you'll have. All right, I'll help you with that. How much does this cost then? I know we need to spend some money to make money.
Yeah.
But I'm telling you, bro, the UAE is the place for alternative therapies. The NAD,
oh my gosh,
drip.
everything.
Bro, they're spending
stem cells,
billions.
Everything. Yep.
Why is this not here? And does this cost more or less?
Yeah, that's a great question. It costs more upfront, but again, if take that 20-year horizon, I'll bet you it's cheaper. I haven't looked at the numbers, but I know in the US a heart bypass is going to be multiple six figures, especially with a long ICU stay. Yeah. Well, I'll give you just a less dramatic example. I had a lumbar fusion, L5S1. So I wrecked my back in Iraq, and so I have hardware in my back. It was a overnight stay in the hospital, and the hospital billed the U.S. Air Force. It was $30,000 for me to be in the hospital for 24 hours just for a back surgery, and I was home, within 24 hours. Completely no complications, no issues, in and out over 24 hours. That was 30 grand, and that was back in 2012. So. Yeah, opening your heart and being in the ICU for a week and then cardiac rehab. I mean, there were multiple six figures for that. So there's that cost, which, is a big one for the system. Or do you want to spend 10 grand? Maybe do you want to spend 20? Let's go crazy. Let's say it's 20 grand to get this massive evaluation done that identifies all of these problems that are incubating, that are just baby problems, and we're not gonna allow you those problems to get any worse, and we're gonna nip them in the bud. it's a huge cost savings, you know, to do something like that.
Yeah, absolutely.
So I would want to, you know, I would want to get that price down as low as possible, obviously, because I want to make it as available to as many people as possible. The fact of the matter is, there are people that are going to be priced out, but there's always things that people can do that don't require them to spend $10,000 for these fancy tests. You know, it's the basic stuff that we already covered, you know, and if I hadn't, you know, unlimited funds, yeah, I would have the Cadillac program, but then I would also have a fundamental program that would still greatly benefit people.
Like a free course and a gym membership.
Yeah, you know, for the construction worker,
yeah,
you know, who needs it as well.
Just as even more in many cases.
In many cases, he needs it more. Yeah, exactly. Because that's the guy that age 30 comes in with a heart attack.
Yeah.
Yeah.
I love that, bro. So let's talk about the model here. All right. Let's say, again, you're at the table. He's listening to you.
Yeah.
All right. You've got to make him believe you, though. This is the thing. Like, I reckon I can get you at a seat in front of someone, but imagine the amount of offers.
Oh, for sure.
They get on a daily basis, right?
Yeah, yeah.
Now, it starts with being qualified. You're clearly qualified.
Yeah, I've been doing it for a while.
Yeah.
Yeah. I think, you know, I can check that box.
Yeah.
Yeah.
So that's the first step. You know, I'm not coming to the table with my face tattoos and a YouTube podcast. You are a qualified physician. You have literally done this professionally 4 years. So you get this seat, but there's tons of other physicians. Do you think or know of any contrary opinions to your methodologies here? Anything that you've heard?
You mean like a better way of doing things?
No, like maybe stigma against TRT.
Oh, sure.
You hearing that here at all?
I have not heard it here so much.
I haven't heard anything.
Yeah, no, I can't. I've heard it in the States.
Yes.
Yeah. But I haven't heard it here
either.
Crickets. It's crickets. Yeah. It's more of like what I haven't heard. And what I haven't heard is high levels of knowledge and expertise in managing TRT. That part I haven't heard. It doesn't mean it's not here. It's just probably at a much lower level. So that needs to change.
I think I know why. No one has thought about this except for you. No, I've literally looked. I've looked at everywhere I can get TRT, like specialized clinics. I've looked at forums. I've gone on Reddit. I've asked people at the gym, and everyone's like, I don't know, like I just get testosterone off my local gym guy.
Yeah,
and I self-prescribe.
Yeah, that's not ideal.
It's not ideal, but they do it because they want their testosterone. They got businesses to run, but no one's actually thought of this gap in the market because if they did, there would be scale here.
Yeah. I'm a bit surprised.
I was going to say the same.
I'm a bit surprised, just especially in Dubai.
Right.
Okay, fine. You know, Sharjah, Abu Dhabi, whatever. But here, like,
it's shocking, right? Do you know how much this exists in business, bro? Do you know how much this exists in business, this concept? So we're in this space. So to us, it seems obvious that it should be here, right? But we're in the space.
Right.
My brother, for example, in software, he talks about these things that the software we use at work can't solve. I'm like, bro, surely there's a program for that. He's like, there's not. I'm like, there has to be. He's like, man, there's literally 10 things I can tell you right now that there could be a software solution for that still don't exist. I think all the normies think AI has done everything. You know?
But it hasn't been done.
Nope. Especially a lot of the back end stuff.
Questions why?
Yep. Because most humans, as they grow up, do the jobs everyone's already doing to innovate, to be the first, to be the man on the moon.
Yeah.
Like, what's the point taking the risk, right?
Yeah, true.
You know?
True.
And unfortunately, the thesis or the consensus is that this is actually a non-essential service. TRT is a luxury. Doesn't that bug you?
Yeah, so that's a great point. That's a great point, actually. Yeah, and it is, you know, no one would think that hormone therapy to treat your low thyroid, for example, is non-essential, right? It's a no-brainer. Yeah, your thyroid is not working. Here's your Synthroid. You're a postmenopausal woman on hot flashes. There's a little nuance there, but yeah, nobody would bat an eye. Mrs. Jones, you need to be on some hormones. But yeah, you're right. Yeah, for guys, it is a you know, and we can probably blame social media for that, but there's a stigma, and it is. Well, not only, it's considered non-essential, but it's also sometimes considered threatening.
Yes.
It's threatening. There's large numbers of people in this world who don't want men to have optimal testosterone levels. And that's not a conspiracy thing. It's just, it's a paradigm that they have. They don't want strong, healthy, assertive men, because to them that equals patriarchy and equals oppression. And we both know that's not the case, you know? So yeah, there's that part of it.
I have an idea. It's a little esoteric. Imagine testosterone was named differently. Like, imagine human growth hormone was actually somatostatin. All right. I don't think it'd get the same amount of cells.
Right.
The fact that it was called human growth hormone
exactly
started that way.
Should never have been named that.
Should never have been named that, right?
Yeah.
Because it doesn't cause growth. But that's not what I'm talking about.
Exactly.
Testosterone, and this is a fault of the sales from the people that sell it. When they go through the symptoms list, you know where they start? The man stuff.
Yeah, of course.
Muscle, libido, right?
Erectile function.
Now that works for the dudes looking for that.
Right.
But when you've got the people at the organizational level who don't want that, that gets them to like, no, we're going to stop this.
Yeah.
But imagine it was called something completely different, and then you reverse engineered bone health, pancreatic health.
Yeah.
Don't you think?
Testosterone needs its own marketing agency. It needs, it needs Edward Bernays, he has to change public perception. Yeah, you're totally right. Because that's when I prescribe it, those are the things I'm thinking about. The patient might not be thinking about those, but that's what I'm thinking about.
Me too. The first thing I think about?
What?
I had low-ish testosterone when I was a natural. I was the same size. I've got double, triple the. Bro, you don't need that much.
You don't need that much.
Barely anything.
No. When I was objectively low. I had primary hypogonadism.
Right.
So, but I presumably had pretty good testosterone, I think, because I was able to, break some powerlifting records. I was, I was at the most, I think, in the off season when I was powerlifting was 250 pounds, and I would diet to 242. I was really pretty strong, natural, completely natural. But even when I dipped below 300 and I felt like dog shit, I still looked pretty good. I could still squat 600 pounds, but nobody would have thought that guy has low T, but I did. I objectively had, even by the current standards, I had low T, and inside I felt terrible. And so, but that's, guys see the muscles,
See the muscles.
They see the muscles. And it's like, no, like I got to that, I got to that level mainly because of genetics, maybe I have a sensitive receptor. I don't know.
That's what I was going to talk about. It's actually what I noticed, the opposite. So Hormozi takes 75 milligrams a week. Alex Hormozi.
Does he really?
Yeah, he does.
Yeah. And he's yoked. Yeah.
Right. Our friend knows his physician.
Yeah.
It's a fact. He has no reason to lie, I don't think.
Yeah.
Why doesn't he just say 100?
Right. Yeah, exactly. Why 75, right? Yeah.
He's just taking 75 milligrams, guys.
Yeah.
I've noticed the guys that take the least, all right, usually look better. Okay. It's just what I've noticed across the board, because they have a sensitive receptor. In fact, your dose to me means nothing. Like nothing. If someone needs 250 when I need 150, I don't care. That's what you need.
Exactly. It's individualized medicine.
That's right.
But the genes genes are everything.
Everything.
I mean, they're just everything. I met a guy many years ago at a conference I was speaking at, and he showed me he's what do you think about my labs? Showed me a little tiny guy, 5'3", South Asian guy, not an ounce of muscle on this guy. Total testosterone was like 900. Free was, I don't remember what it was. Solid like 17, 18. It was good. He looked like he was on TRT. He wasn't. He wasn't on anything. So high testosterone level. But you would have picked him in the lineup. Like, who has low T? You would have picked him. So you can't tell. That's not what this is about.
Not what this is about.
Right?
Oftentimes not even correlative. Oftentimes the opposite.
No.
So we'll reverse engineer this for anyone at the organizational level here in the UAE who doesn't care about muscle or to look aesthetic. It's not part of your culture. I get that. I respect that. But here's what happens when you don't have sufficient testosterone levels, and we're excluding two of the symptoms. You're going to exclude libido,
okay,
and exclude muscle.
Yeah.
Tell me about the rest.
Yeah. So we talked about insulin sensitivity already, right? So, and that is, that is related to muscle, but independent of muscle, testosterone in and of itself will help control blood sugar. It lowers insulin levels. It lowers hemoglobin A1C about as well as first line diabetes drugs.
Wow.
It works as well, as metformin. So in men who have low T, if you're already rocking a super high T, you probably don't get the same benefit. But if
Sure.
you're low, you absolutely benefit from that. And then again, what are the downstream effects of that? It helps with body fat in and of itself, independently of the muscles, et cetera. So again, we talked about it earlier, body fat, especially visceral body fat, which is like the root of all evil in a lot of ways metabolically, that's diabetes, that's hypertension, that's cardiovascular disease. So anything you can do to lower visceral body fat, testosterone that helps with that, will downstream affect all of those other things as well. So it's independent of the muscles. It's independent of libido. It's independent of erectile function. If you want to talk about the brain, so the downstream metabolites of testosterone, estradiol, DHT, and then their metabolites, which nobody talks about those. It doesn't stop there. Neurotransmitters, depression, issues with mental illness, all of these can get better if you have a proper amount of testosterone. I can't tell you the number of guys who have come to me on SSRIs diagnosed with depression, clinical depression, and have genuinely been depressed and not suicidal. No one's ever checked a testosterone level on them. And in many cases, they're objectively low. And you correct the testosterone. I have a good personal friend of mine who's a retired firefighter, battled severe depression for decades and was on multiple antidepressants, even antipsychotics at one point. And I put him on testosterone because he was low. Nobody had ever checked it. And it's like the clouds parted, and he came off everything.
How they not be checking this stuff?
So that's what I say. It drives me crazy. So that gets back to, increasing awareness among physicians too. Maybe you don't want to be an expert in TRT. I get it. Like that's not your jam, but at least be aware, when you get somebody who has some of these chronic medical conditions, think about an endocrine cause. There's something there. It's your responsibility to at least look for it. If you find it, maybe you don't want to treat it. That's okay. You can refer them to somebody. Refer them to me, anybody else. But it's just in medical school, nobody ever taught us about testosterone and depression. Nobody ever taught us about testosterone and insulin resistance. Like you have to seek that out. You have to kind of learn about it. And the endocrine system gets no respect.
Nothing.
It really doesn't. It really doesn't, and I know it drives the endocrinologist crazy because that's definitely their wheelhouse. But, the regular family doctor, internal medicine doc, it's a bit of an afterthought. And it's not their fault. They just haven't got the proper education, And again, that education can be remedied. You can remedy that. So,
absolutely.
But so many different areas besides muscles and erectile function that testosterone affects. Those are like nice side effects. Okay. It's a nice side effect to be able to have a nicer physique, perform better in the bedroom. Yeah. Like who doesn't want that? But it's the other stuff. Like it will prolong your life if you also do the lifestyle stuff. It will improve the quality of your life. The other thing, this is related to muscle tissue as well, but I've talked about this on podcasts and maybe people don't appreciate it like I do because I've seen it as a physician. If you, Daniel, walk, we're done here with this podcast, you go across the street and God forbid you get hit by a car, boom, you just get shattered. You're going to be in the hospital for a very long time. A very long time. You're going to atrophy. You're going to get weak. You're going to be in bed. There's a really good chance that after all of your major injuries heal up, that you're going to be too weak to walk. So you're ready to go home from a medical standpoint, but you can't walk. You can't go home. You have to go to a rehab center. Now, do you want to go through that, severe trauma and illness with, hypogonadal testosterone levels? Or, would you want to go into that as healthy as you possibly could be with a solid amount of muscle tissue that you can afford to lose because you will lose it? It's like money in a savings account that you can draw on if something really catastrophic happens to you. So what I see all the time is elderly, not even elderly people anymore, middle-aged sarcopenic dudes, like we're talking 50 years old, who they don't have 10 pounds of muscle tissue to lose. So they come in and see me. Maybe they're septic from pneumonia and they get put on a ventilator and they're in the ICU for a week. But the point is that muscle reserve that keeps that guy functional and living independently, it's gone like that because he has so little to lose. There's nothing in his savings account. So if that guy goes into that acute illness with 20 or 30 pounds of extra muscle tissue, less visceral body fat, and is metabolically healthy, he's going to have a better recovery. You know, you're going to be able to weather the storm a little bit easier if you're optimally healthy. So you're going to do fine. But some of the patients I see, you know, same exact set of injuries or same, you know, illness, they don't do fine. You know, they get complication after complication. You know, the longer you're in the medical system, the more likely you are to have an adverse outcome, a medical error or an infection or just something. You want to use the medical system when you need it, and then you want to get out, you know, and then you re-engage when you need it, and then you get out. You don't want to be trapped in I call it the belly of the beast. You know, you start developing these chronic illnesses, and guess what? Now you're in. Now you're dependent on prescription drugs. Okay, now you're going to be in the hospital longer than maybe you would have been before, and now you're exposed to all this risk. You know, I lost my grandfather, went into the hospital for something fairly routine. I don't know what it was. He caught pneumonia in the hospital and died 2 days later. You know, so the healthcare, you know, being in the hospital is dangerous.
Yeah,
It's
I can
dangerous.
imagine.
People all the time like, aren't you going to admit me? I want to be admitted. They say, and I'm like, listen, no, you don't. You don't want to be admitted to the hospital unless you really need it. So anything you can do beforehand to keep yourself out of the hospital, which involves everything that we've already talked about, including testosterone, you need to do that. Because there's a dark side to being in the medical system. You just don't want to go down that road.
The epitome of preventative care.
Yeah.
There's more then. So let's go back to me getting hit by that truck.
Yeah.
Let's say I do get hit by that truck and I come off okay, but my testosterone is good. Why do you think that would be as opposed to the low testosterone me? What would make me more resilient? Bones, nudge, nudge.
Yeah, well, so yeah, exactly. So you would have had a decade of healthy bone tissue, a decade of increased. Again, you have a savings account that you can draw upon. When you lay in bed, the muscle tissue melts off of you. When you're not moving, even if they're feeding you, you're not moving. You're losing bone mineral density. You are losing muscle tissue, and it goes. And it's shocking actually how fast you lose it. And when you're always super fast. And the scary thing is over the age of 50, you don't get it back. Like it becomes progressively more difficult. You know, that same accident at 25, you're going to make a full recovery, you know, in terms of muscle tissue in most cases. At 70, you're done. You know, you lose 20 pounds of muscle tissue, you'd be lucky to get 5 of that back, you know, in my experience. So that's the difference between grandpa living at home by himself or now he has to live with 24-hour care. That's a little bit of a muscle tissue makes all the difference. So that's where, you know, the testosterone doesn't directly like save your life. No, it's these indirect effects chronically over time. And it's not just testosterone. It's all the hormones. It's the lifestyle. It's all the things you do. You make yourself hard to kill. You want to be hard to kill. So
that's a great way of framing it. Let's talk about, again, getting hit by that car because you're an emergency physician.
Yeah.
I promised Dr. Khalifa, shout out to you for raising this. This is super normal in Australia. Ambulance comes, lights are on. You move out the way with the car.
You should.
Apparently here, it doesn't happen.
I know.
I've seen
it too.
It's an ambulance jammed up and he's stuck and there could be someone in that car dying.
Yeah.
Now, you're a physician.
Yeah.
How many people have arrived too late due to this? Honest.
I'm not going to say too late. Well, it's hard to know because certainly like I've had people that arrived and I've lost them, you know, they came with vital signs and they lost them. I couldn't get them back. I don't know what happened before they got to me, you know, so it's hard for me to answer that question, but it's very clear that the sooner you get to the hospital, if you have a critical injury, time is of the essence. And, in military trauma, it's that in trauma in general, it's that golden hour, right? It's that first hour after your injury. We need to get you to definitive care. So there was an interesting study in the US, and I don't know what big city they did it in, but they basically found that, like, for these drive-by shootings, that if you came to the hospital by, they call it the homeboy taxi. So, you're standing out with your bros, and somebody comes by and sprays you with AK rounds, you get shot. Are you more likely to survive if your bros take you, throw you in the back of the pickup truck, and haul ass to the hospital? And they used to do this when I was in Texas. They'd screech into the ambulance bay. They'd throw the guy out of the car onto the ground and then take off. It was usually gang related stuff. If you were that guy, or if you call 911, what's the survival rate? It's the first one, because they get you to definitive care more quickly. So that's, people, get out of the way. If you see an ambulance, get out of the way.
It's a law now, apparently.
Yeah, well, it should be.
It was a law, but now they've enforced.
They need to enforce it.
More strict fines. That actually segues me into here with the UAE. I feel that the laws that are enforced here very strictly are the laws you want enforced.
Exactly.
As opposed to Australia, they will hunt you down if you're not wearing a helmet on an e-scooter going 10 kilometers.
Right.
In Australia, the law is the law, and the law is the law here too, but the laws they're creating, almost anyone can be a criminal for. Okay?
But they make sense here. They make sense. This is how you make society function, in an organized fashion. And yeah, part of that is getting out of the way when the ambulance comes. Yes. Again, you don't know. That could be your loved one in there. You don't know.
Yeah, it's a scary thought, bro.
Yeah.
One of the reasons I came from Bali to here is, bro, when you're stuck in that Bali traffic and you got to get to a hospital.
Oh, I can imagine. You're not. You should get out and run. You get there faster.
Legit.
Right? Yeah.
That's the thought,
right?
Yeah.
Yeah. If you can run.
Yeah, that's right. Yeah. Okay, cool. Now there's one more we have to talk about with testosterone.
What's that?
Outside of libido and muscle, that is to sell it to this, organizational guy in the UAE. He's a health professional, so he knows a thing or two. What happens to your RBC count when your testosterone is low? And what happens when RBC count is low?
Yeah. Well, it tends to go up. It tends to go up.
With testosterone therapy.
With testosterone therapy. Not in all men. And it varies by delivery method. Of course, injectable intramuscular testosterone, especially cypionate, it's probably 60% of men will have some sort of bump in their hematocrit. And I say, okay, so what?
But is it a good thing if someone is anemic?
Can be. If they're anemic,
that's what I mean.
So yeah, certainly if you are anemic, a good example is, dialysis patients are usually chronically anemic. People with chronic kidney disease, especially the later stages, are chronically anemic. They also happen to be, most of them, low on testosterone. So they would, those kind of people would benefit from a few more extra red blood cells. The other side is, what about the normal guy whose red blood cell count or hemoglobin level is now outside of the upper limits of the normal range? It's an area of controversy, but if you look objectively at the literature out there, it's very difficult to say that you, as an otherwise healthy man, if you're running around, let's just say you have a hemoglobin of 18 or 19, that you are at increased risk of thrombosis. So blood clots, strokes, heart attacks. Good luck finding data on that. Like,
can't find it.
You can't find it. Now, what you can find is other populations that have similar numbers as you, and you can look at those, and those are people living at high altitude. And what you see generally is there's no increased risk. There's no increased risk in those people. Now, I understand, like, we don't have definitive answers on this. And so, when it starts getting a bit ridiculous, do I get a little bit concerned? Yeah, I do. But I think it's on a case-by-case basis. If you're young, metabolically healthy, and you don't have a lot of or any underlying disease, you're going to be low risk almost regardless of what your hematocrit is. The gold miners in Peru and La Rinaconda average hematocrit's over 70%, and they live there for years.
Wow.
Day in, day out. But they're young. These are young, like, healthy. They're mining gold. Would I want, a frail, elderly, 80-year-old with kidney disease, heart failure, aortic stenosis, et cetera. Do I want him with a hematocrit of 58, 59? Probably not. Probably not. So it's going to be, there's a lot. It's not just a blanket answer, but it's a known effect. It's a benefit. I mean, that's what testosterone does. That's why men have higher hemoglobins and hematocrits than women. It's because of testosterone. That's why we have a performance edge, run faster, longer, stronger than women. It's one of the reasons. So it is what it is. Yeah, and it's not something to be worried about. It's a beneficial therapeutic effect, and there's going to be a population of men that perhaps put themselves into an area of potential danger, and there are ways to manage that, and it's not rocket science. It's usually just modifying their protocol. They don't have to come off testosterone. They don't have to donate blood every 2 months, which is typically what you see.
The tabling.
Sorry.
I think he's looking.
Sorry.
It's not for me. It must just be like really affecting his sound quality.
Yeah.
We'll get that right. But talking with your hands like a man, it's important. It's important.
Yeah, I'm trying to emphasize the point. So
I've been told that people really like it. It's part of like the honesty when you talk with your hands.
Yeah.
It's when you're lying, you typically don't talk with your hands.
Yeah, that's a good point.
You know what I mean?
Yeah,
You're like there, you're sitting there like,
yeah.
This is part of it.
Yeah.
Yeah.
Exactly.
So I'm the same too, but I'm just trying not to hit the table.
Yeah, you're more disciplined than I am. I forget.
You get used to it, bro.
Yeah.
I get told off a few times. It happens on Joe Rogan all the time.
Oh, I'm sure.
Yeah, he tells it all the time.
I'm sure.
Okay, so I'm actually not worried about the high hemoglobin stuff.
You shouldn't be. I don't think you should. I'm not either. My hematocrit's 54%.
There you go.
I don't worry about it.
Mine's,
I don't worry about it.
I haven't checked my blood work in 2 years, guys. We'll talk about that next. Nearly 2 years. But before we do that, I want to talk about what happens when hemoglobin's low due to low testosterone, because there's a direct effect that testosterone increases hemoglobin via the kidneys, right? Can you speak about this?
It does. Yeah. It's a complicated mechanism. And testosterone is not, it's just one factor, and so you don't tend to see a lot of, at least I haven't, isolated. So a man with no other medical issues other than low testosterone, it'd be very unusual for them to be anemic, truly anemic just from low testosterone.
Okay.
Is it possible? I suppose it's possible, but there's so many other mechanisms. There's other ways that the body can dial up erythropoietin, to compensate for that. If that condition exists, I've never seen it.
I see it, but it's not technically anemic in terms of the thresholds. That's just what I mean. Lower hemoglobin than I'd like.
Precisely. Yeah. So they may be on the very low end of the normal range. And that's the case.
See that a lot.
It's not uncommon. Yeah. And here it's interesting. I see a lot of guys like that. But many of them have thalassemia. They have thalassemia trait, or they carry one or more of the thalassemia genes.
Right.
So they're just sort of low grade, not quite anemic. Their MCV, which is a measure of like how big the cells are, they're just a little small. Okay. And so it's just, this is the genetics of this part of the world.
Okay, fair enough.
You see that, as well.
Let's talk about me then quickly.
Yeah.
Because, I'm on this health podcast. We've got to talk about me.
We've got to get something out of it.
Year and a half, I'd say, I haven't had a blood test. I wouldn't know exactly. But the reason I didn't get a blood test is because of Dr. Andrew Winge, actually. He said we need a decision node when he's in his emergency department to run a lab test. There's so much going on. He's got to save a life. Don't run that blood test unless you can tell me exactly why. Yeah. Well, I can't tell you why I'd get a blood test right now because I've been checking the thing for 14 years.
Yeah.
It's the same every single time. Not even close to an issue.
Yeah.
What is it that I'm going to find?
So you can definitely make the argument in a guy your age with literally no medical problems that, do you need annual blood work? Probably not, right? Probably not. So it's when you have these other medical issues, when you become a type 2 diabetic, you're getting blood work, pretty regularly. Would it be a good idea if you change your lifestyle changes radically, your diet changes radically to get some additional, like a lipid panel, get an ApoB, that kind of stuff. But if you tell me, my ApoB has been 60 for the last 5 years in a row, I'll be like, I know, right? Yeah. I wish mine was naturally that low.
Do you know what brings up my ApoB? Just quickly interject. When the testosterone dose goes up, it goes up.
It does that.
It does that.
Yeah.
That's why another reason why I've brought my dose
a little bit.
A little bit.
Yeah. Yeah. So, and it will fluctuate. Yeah, it will fluctuate. I've never seen huge ApoB increases with just testosterone. Now you start adding in synthetics,
Yes.
trenbolone and stuff. I've seen some scary LDLs and ApoBs. Those other agents. That's a whole different ballgame. But testosterone, it tends to be relatively neutral with LDL, ApoB. It can lower HDL a little bit.
That's another one. It seems to happen simultaneously for me.
Yeah.
It's like this signal to me that it looks like I'm on gear, because all my gear user friends, I'm like, let me look at your livers. Yeah. Classic. It's all this classic taking gear symptom.
Single digit HDL sometimes in these guys. You're like, I know what you're taking.
Low SHBG, SHBG.
Very low SHBG.
Very low.
Very low.
Well, that happens to me on a very low dose.
So you're sensitive. You've got a receptor issue, but that's why a little bit goes a long way, likely for you. So
200 milligrams a week would be way too much for me.
That would be way for you. That would be, you wouldn't sleep for a week.
Yeah, that's the main symptom. It's the less sleep that I get. Actually, all of my friends that bodybuilder, I'm talking all of them. All of them are like, I don't know what sleep is. And some of them are like, I always don't sleep that good. Like, I'm just used to it.
They've put 2 and 2 together, I'm assuming.
Some don't even think about it till I ask them. They're like, I had like 5 hours. What? You had 5 hours last night. You're like, I'll nap later. You nap. You need to nap. It's like, I get tired in the day. What do you mean?
I can catch up with you, I can catch up with you.
That's bodybuilding though, bro. Do you know what I mean?
It is.
That's part of it.
Yeah.
No,
I love those guys, but they do some crazy stuff.
That's what makes them great though, because they're not focused on this stuff.
No, not worried at all about it. They probably should be.
Do you know why I'm focused a little less on it though? For my own reasons. Here's something I've noticed for the young blokes listening in. Yes, it's important to take care of your health, and you listen to guys like you.
Yeah.
But bro, there's the guys that are focusing so much on their biohacking routine and they're not working.
Yeah.
We got to work to make the money first.
Exactly. And how much of those guys move in the needle, right? At the extreme edges, there's a point of diminishing returns.
Yes.
It still gets back to hormones, nutrition, exercise. That gets you 90% plus of there. And then, okay, if you want to devote hours and hours and years to that last 10%, okay. You can do that. That's a personal decision. I'd rather get that 90%, maybe get a few more percentage points, and then go hang out with my wife and my boys.
There you go.
That's it.
That's why I don't check my blood pressure all day anymore, bro. Because
no, don't do that.
I got things to do.
Right. Check it every now and then.
Every now and then.
Yeah.
And you talked about decision nodes.
Yeah.
Even if I got I'm not joking, guys. If I got a blood test tomorrow and you come to me and you're like, look, I'm not that happy with this, I'd be like, cool, I'll live and let die. Because there's nothing else I can do in my life, bro. I don't drink. I don't smoke. I don't take red drugs. I try to go to bed at the exact same time. There's nothing else I can do.
Right.
And if someone goes, well, you cannot have that pizza, I'm like, mate, every 5 days, what me and her do,
pizza.
we have our pizza, cookie, whatever.
Yeah.
I'm not going to get any healthier than this.
Exactly.
It's a decline, if anything. So the only thing you can do is add drugs to me from here.
Exactly.
That's it.
Yeah.
And I'm not going to the gym anymore, bro. I spend a lot of time in the gym.
Exactly. No, I love to work out, but at the same time, I got better things to do. I got a lot of stuff I got to do.
Yeah.
And that's why over the years, I graduated to the high intensity in and out. My workouts are 30 minutes, roughly every other day.
So no zone 2 is, you can't fit in this model, the zone 2.
Not as much. I would, if I had more time, so that would be the extra few percentage points that I could do. Cause I actually even enjoy zone 2.
Me too.
I can throw in a podcast or something and get on the bike or the treadmill, but, I'm just too busy, man. I'm too busy right now.
Yeah. How do people do it? So I do it because I got the time right now, but when I'm going to be focusing on the company, I'll either have to be doing it while I'm working if I have the privilege.
Yeah.
Let's talk about this because we are the inverse. You do the high intensity stuff, no zone 2. I do none of the high intensity stuff and only the zone 2. The reason I don't do the high intensity stuff, for whatever reason, bro, I just can't recover from it. Like the next day,
it digs a hole. It really digs a big hole. Yeah,
I got less healthy.
There's no question. Yeah, there's no question. And that's why it's like, it's the dose that makes the poison, right?
Yeah.
With everything, drugs and exercise for sure. And that's one thing I've noticed as I've gotten older. Even like up until my early 40s, I could still perform at the gym and jiu-jitsu. But boy, as time has gone on, and now definitely in my 50s, you know, I have to I have to think about it. You know, I have to factor in, I've got a leg day tomorrow. So
Day off today, for example?
do I want, today's an off day. And then I'm like, well, you know, I've got 3 ER shifts and they're all in the critical bay after my leg. Maybe I don't want to do legs that day because I'm literally going to be limping around, you know, in the trauma bay and where you have to, you know, run around.
That's how hard you train still?
Sometimes, yeah.
That's UA.
I mean, I just like to train hard, you know.
I can tell by the way you said that. I was like, he's
yeah,
still doing it.
I'm still doing it. Yeah. I'm a little, some lessons I will never learn.
I've stopped, bro.
Yeah.
I've stopped those sets.
Yeah.
You know why I stopped them?
Joints?
The mental acuity, bro.
Oh, okay.
Bro,
Tell me about that.
Only need one of these sets in a workout for me to feel like this for the rest of the day. One set.
Yeah.
And it's typically 2 reps past what I do now. Now, don't get me wrong, guys. I'm not doing the RIR stuff to 2. I'm talking technical failure.
Yeah.
But, bro, when you train the way you train, I know how you would train.
I train to failure.
There's always
or
more.
Close.
There's always more.
There's always more, but I train by myself.
Okay.
And so you know how it is. When you have a spotter there, there's a safety issue. Like on leg press, I've got probably 2 in the tank because I'm not going to go for those 2 final reps because they're going to have to get a crowbar to get me out of the machine.
Yes.
You know? So I always keep like 1 or 2 reps in reserve in those dangerous situations. But the other ones, you know, like
bicep curl,
whatever. Yeah. I'll go to failure.
Yeah.
I just like it. There's something very primal about it.
See what he said?
Yeah.
He likes it.
I like it.
And I feel like all the guys that are in shape into their, you know, 60s, 70s, they just love it, bro.
You like it.
You got to actually force yourself away from the gym.
For sure.
That's our problem.
Sure. Yeah, after I've had a few major orthopedic surgeries, and that was the worst part of it. The surgery wasn't the problem. It was the not being able to train, you know, for a month or whatever, you know, whatever the case was afterwards. It drives me crazy. Yeah. If, you know, I can honestly say if I was the last man on earth here in Dubai, was nobody, I'd find a gym down here, and every day I would just go down to the gym by myself, and I would, because I feel good. I feel good when I do it.
Same, bro.
Yeah, I feel good. But the recovery, getting back to that's what changes as you get older. I still can put up relatively decent weights for my age, but the recovery is like a fraction of what it used to be. You know? I was indestructible, man, in my 20s. Fucking destructible. You know? You're
definitely, so there's a few categories. Now, I've been a coach. I speak to many of them too, and I know these exist. You do too. There are people that roll out of bed with an amazing VO2 max. Literally met them.
I'm not that guy.
You know, Quillen Salkild is one of those guys, Perth fighter.
Yeah.
His parents were triathletes.
Yeah.
Both.
Right. It's genes, right?
There you go.
Genes.
All right.
It gets back to genes.
Then there are guys like me who's somewhere in the middle.
Yeah.
Then there are guys also that are doing 100-mile races that are 100 kilos. You are in that elite category. And I know this based on like when you tell me the volume that you do in the past, because anyone else in the middle or lower categories, they do it. It's not weakness. They break down. They not only do they break down, like some people break down and get rhabdo.
Yeah.
Legit.
Yeah. I've had a couple of buddies.
Forced to break down. You can't, not everyone can Goggins, like you will die.
No.
Guys, you can die.
Right.
We know an Australian fighter, very sad, a few months ago, he died. Got rhabdo and then went and fought. Yeah, bro, he fought anyway.
No kidding.
Yeah, Guy Bruce.
His coach should have
very, very sad,
picked up on that.
Died after the fight. Very sad.
That's tragic.
Anyway, so where was I going with this? I don't know. Anyway, elite fighters, guys in the middle like me. Yes, I know what I was saying. If I had to plan out my ideal month or mesocycle, all right, I would actually only go to the gym. I swear to you, I've figured this out 3 times a week. Having a day in the middle for the cardio, I swear, bro. But I don't. I go more.
Yeah.
What would you? What would be the ideal?
That's exactly right. So it would be 3 days of weights and 3 days of jiu-jitsu. And in fact, before I moved here, when I was between jobs, I had some time off. That was the sweet spot for me. It was Monday, Wednesday, Friday. And my jiu-jitsu gym was right next door to my weights gym.
Perfect.
It was perfect. So jiu-jitsu was at noon. At 11 o'clock, I rolled in. I did my workout. Finished up with the weights. I went straight to jiu-jitsu class Monday, Wednesday, and Friday. Now, the weight workouts were always intense, always hard, always have been. Jiu-jitsu, especially at my age now, Mondays and Wednesdays, these were lighter rolls. You know, there's a lot of technique, a lot of drilling, maybe one hard roll, you know,
One good round.
maybe an uppity blue belt that needs to be corrected, you know, that sort of thing. But then the Friday would be, you know, I would be in there for the 5 or 6 rounds, and I'd be rolling with my upper belt buddies, and we'd try to murder each other.
Yeah.
But that's all I could handle, you know. And even that, I was chronically sore, you know, just 24/7, all the time, limping around. But I felt good. You know, I liked it. Like, that was sustainable for me.
Nice balance.
Yeah, but it was not 3 hard rolls per week, which is what it used to be. You know, when I first started training, it's 2 light days, 1 hard day. When it comes to the grappling, you've grappled. I mean, it's, dude, whole body exercise. You're cooked. There's nothing else like it. So
tendonitis all over,
everywhere. Chronic tendonitis. That not even BPC sometimes can touch. So, yeah, I had to really dial that back and be conscious of it, because I was getting injured. You know.
That's why I stopped, bro.
Yeah.
The tendonitis was,
it's bad.
Couldn't go to the gym.
Yep. Yeah. I had, you know, epicondylitis all the time from getting armbarred all the time. Yep.
And my Achilles.
Oh,
bro,
interesting.
because we wrestle. There's a lot of takedowns.
Yeah, that's
when I
a
have
rough
to
one.
spring in, bro, it's that movement. I'm always doing an Achilles.
Yeah, exactly.
Very common.
So,
yeah,
you know, you just have to adapt. So, you know, I don't do jiu-jitsu to be a world champion. I'm a hobbyist when it comes to jiu-jitsu.
But he's a black belt.
Yeah,
he's a very
but I'm a truly mediocre black belt. I get schooled by the real black belts here in Abu Dhabi all the time.
There's some high level.
They're so high level, man. They're way beyond what I would love to be at that level, but I know what it takes to get to that level. I have other aspirations, you know.
Still, black belt is a black belt.
Yeah. Sometimes, you know, the black belt is the white belt that just wouldn't quit. I'm that guy. You know, it took me 17 years to get my black belt.
Depending on who gave you that belt, it's hard to get them, bro. It's not like karate. Yeah. It's not like Shotokan.
No, well, true. Yeah. It's not. Yeah,
which is what I did when I was young.
Yeah. No, I got it. Yeah, my professor Paul Moresi, who's got his belt from Half Grace, who was legit.
Yeah, very good,
very legit guy.
Because we know there's a lot of stories about payment for belts, etc. You get that too?
You hear stories about that. Yeah. But you know, in jiu-jitsu, you don't want to be that guy.
No,
you don't want to be the brown belt that shows up and gets schooled by blue belts and white belts. You know, that happens. So I was happy to take 17 years to get get a black belt. Yeah.
That's amazing, bro. Oh, let me paint this picture for you. You tell me if you agree or not agree. All of the guys that I know that are in shape, especially in their 40s and 50s, it's not like a 20s fad for women or an elite sport. They report to me at least 1 day a week, maybe 2, where they're like, I'm trashed. And the reason is because in order for me to know that I got my dose, I need to know I went too far.
Yeah.
How do you know?
Unless you try.
All right.
Yeah.
So today is day 4. I've done 3 days in a row, push, pull, legs. Yesterday was the legs. Today I woke up and you get up and you're like,
yeah.
That's the day. I'm not going to the gym today.
You should listen to your body.
Yep.
Yeah.
Now, some days I even push one more beyond that. That always ends badly.
Don't do it. Don't do it.
But we enter in this state of fatigue where if you were to actually check diagnostics, this is important, this question. If I was to check my diagnostics today as opposed to yesterday where I felt very rested, how misleading could that be if I chose today to be that day for diagnostics? My BP, this is the sort of question because like the snapshot in time thing.
Yeah.
Explain
I mean, your resting
this.
heart rate is obviously could be elevated.
10 plus.
Potentially, you know, your blood pressure may be elevated as well. Certainly like your inflammatory markers might be higher than they should be. So yeah, that's not the day to go and do the $10,000 checkup.
Yeah.
You know, take a few days off.
So a few days off.
Yeah.
Before
your liver
diagnostics.
enzymes can go up.
I
did a podcast on that. A lot of guys will come with, you know, elevated liver enzymes. And one of the first questions I ask is, when's the last time you trained with weights? And they're like, the day before. I'm like, well, okay, let's do me a favor. Let's have you take a few days off. Let's repeat these. And invariably they come back down to normal.
Like a lot.
Yeah.
Wow.
And then if they don't, then I'm like, okay, now we need to do a workup.
Sure.
Let's look into this. But they come down.
It's incredible, isn't it?
My liver enzymes, going back into my 20s, I have blood work from way back when I first joined the military. chronically elevated. And I went through 2 big workups when I was on an active duty, including liver ultrasounds, all normal. And
These are
it was
just the
training.
transaminase.
Yeah, AST, ALT.
Okay.
Yeah, not the rest. Yeah. So it's from training. That's not a big deal. But it freaked out. Every time I would go to a new base, I get a new doctor, a new primary. Your liver enzymes are high.
How elevated though?
I know. Probably 10 to 15 points above the upper
nothing.
limits normal. Yeah, it's not scary high.
Shows me you're an athlete.
Yeah. Well, that's how I interpreted it. Yeah. But they're like, we need to make sure you don't have Wilson's disease or
really,
like crazy stuff. Yeah.
This to me is crazy.
Yeah, but that's what you learn in med school, though. There's a workup. There's a workup for elevated liver functions, and it's a shotgun workup. And you don't always get common sense inserted into that. So
that's crazy.
Yeah.
Because what we were actually taught, all right, is that if it's just AST and ALT or the transaminases, in isolation to GGT,
right,
it has to be at least 3x normal range in order to go for that follow-up with the ultrasound. 10 to 15% never warrants anything other than another blood test in the future, which is odd because that's where I see kind of like money being wasted and unnecessary anxiety on the patient.
Yeah. And again, everything is on a case-by-case basis because, 2 conditions can present with just these sort of smoldering AST, ALT elevations. One is chronic hepatitis C. You can actually have periods where it actually is normal. And then, you'll get periods of inflammation when the virus is more active. So you can miss a hepatitis C diagnosis, which you don't want to do. And then fatty liver disease. Sometimes they're not 3 times
But
normal.
you'll see other stuff with that, though.
Yeah, you'll see, metabolic syndrome, lipids, triglycerides, all that stuff, for sure. Yeah, it's not in isolation. But, I personally don't, just because, let's say you're 5 to 10 points above the normal range. If I don't have an obvious explanation for it, I personally chase that down because I've found guys with hemochromatosis. That's one of the more common things that I found. I send them, I get your iron studies. Oh, lo and behold, look at this. Your iron index is elevated. And then I do the gene testing and you've got hemochromatosis.
That's me.
Yeah, exactly. We talked about that. So I've picked up a handful of hemochromatosis cases just based off of elevated liver.
Very
enzymes.
Difficult to treat without issues.
For sure.
Because it's basically, if the monoclonal antibodies don't work, it's basically it's
phlebotomy.
Phlebotomy.
But only if you have iron overload. If your ferritin is markedly elevated.
That's me.
Yeah. What are your...
Haven't checked it in a while, but it's anywhere from 500 to 900 at times.
Yeah, so it's elevated, but I bet a lot of hematologists wouldn't get super excited about that.
One time I had it over 1,000.
It's over 1,000
after a surgery.
Yeah, well, you were inflamed.
Yeah.
That doesn't count.
Yeah,
it doesn't count. So,
but the transferrin saturation is always high. It's close to 60.
Yeah. Have you done the gene testing for it? Yeah.
But my auntie's got it too. They've got it.
Yeah. There's multiple different genes. I never knew, they didn't teach us this in med school because we didn't know. But not all of the gene variants actually result in iron overload. But your TSAT will be through the roof. There's an H63D variant that a lot of times they don't need phlebotomy. So.
Apparently, it's super common where I'm from. It's this place in northern Italy.
Yeah. There's a group there. Huh?
There's a group there or whatever.
Yeah.
I just haven't done anything about it because I don't have any symptoms.
Probably don't need to.
My auntie never did either, but they started just drawing blood.
Yeah.
And then I was like, did you do the ultrasound on the
or an
liver?
MRI of the liver?
No.
Yeah.
That's kind of the way it works in Australia. They don't even do that at times.
Right. Well, it's a socialized system, right? They're trying to cut corners, save money.
It's expensive.
Yeah. Well, when I open up a clinic, come see me and we'll MRI your liver.
Yeah, all this stuff, by the way, it's not like I'm super lazy. It's just anything sub 40, I'm just not ready to go and give blood right now when I feel so good.
Yeah.
Same with the scope. So I did a scope once. My uncle died at 44 from stomach cancer. Yep. And if you have digestive issues, you know this, and it's in your family, not just him, all right? This colon cancer, stomach cancer thing is huge. And it's simple scope.
Yeah.
But because of the inconvenience, I hated it last time, bro.
Yeah.
I'm not going to go do that again until I'm 40. I was cleared.
Yeah.
I'm okay.
Yeah. The yield, what's the yield on that, with no change in your symptoms, if you suddenly can't swallow food.
Yeah.
Okay. Now you got to, someone should probably take a look down there. That happened to me, by the way.
Really?
I started having difficulty swallowing and I had a food impaction. And anyway, long story short, I had to have a scope, and I have eosinophilic esophagitis, which is a weird allergic eosinophilic inflammation of the esophagus that.
How painful?
The steak was pretty painful because I let it was in there. Just because I'm a doctor doesn't mean I'm a smart patient. So I was like, I am not going to the emergency department for this. There's no way. Like I will make this pass on my own. Well, 8 hours later, when the pain started radiating into my back and up into my jaw, and I'm like getting sweaty, I'm like, all right, I got to go in. Anyway, long story short, I went in just before they wheeled me off to the scope. It passed. So at that time, I didn't get the scope. I followed up later and got it as an outpatient, and that's where they diagnosed it. But it flares up every now and then. They put you on an elimination diet, which really didn't work for me. I went strict carnivore, actually.
And it didn't work.
It didn't work.
Wow.
It didn't make a difference. So, there was something else in the environment. Interestingly, since I've moved here to Abu Dhabi, it's been pretty much in remission. It flares every now and then, but it's way better here. It's something in the US, something in the environment there.
Can be a plant steroid or something like that.
Who knows? Maybe it was a detergent I was using. I have no idea what it was.
Bro, this is so interesting. I want to talk about this because it happened to me and friends. In Perth, Western Australia, we have certain native like fauna.
Yeah.
And we're famous for hay fever.
Oh,
and
sure.
What's it called? Rhinitis?
Yeah. Allergic rhinitis.
Bro, like it gets there and I get headaches and blocked nose and nothing helps. So many mates get it. I went to Thailand for the first time when I was 21 and I landed and I was like, bro, it's gone.
Exactly.
I didn't think of it. Then I come back to Perth and got it again.
There you go.
And that's when I realized just the environment can help with this
Absolutely.
and that.
So there was something that was triggering this. And I've never had an autoimmune condition. I've been healthy as a horse my whole life, other than my lipid issues. So this was really weird to me.
Very strange.
And I was like, you catastrophize. You're like, oh, I've got a mass, I've got cancer or whatever, because I was 48, I think, at the time. So this is it. Like, I've had a good life. This is it. I'm a goner. But, thank God it was just eosinophilic esophagitis. But yeah, very interesting. Since coming here, it's 95% cured.
That's incredible.
Yeah. So I'm happy about that. But I don't have a good explanation. I don't know. Even the GI doc, I was like, teach me about this condition because I didn't know much about it. And she was just all like, well, we think it's this and you should maybe cut out fish and cut out, I'm like, okay, I'm going strict carnivore. And yeah, it didn't make a difference. Leaving the US has made so many things better in my life.
Yeah, wow.
Yeah. Not just my esophagus. This is it. I'm healthier here.
Absolutely.
Yeah.
Because now that you're on the topic, we'll talk about esoteric rare health conditions.
Oh God.
Because it's just fun to talk about because everyone seems to have one. Yeah. I got one, you got one. So I'll share one with you, two of them.
Yeah.
When I went for gene testing, I had long suspected this. I have a CAV3 gene mutation. Guess what one of the side effects are?
What is that? It's digestive issues? What?
Calf hypertrophy. Have you seen how big my calves are?
They're ridiculous. Yeah.
Now, my calves are like IFBB Pro bodybuilder calves.
And you haven't had to train them excessively.
They
are what they are.
They are what they are. They were like this. That's right.
It's a gift.
Okay. So there is
that's hilarious,
isn't it?
Yeah.
Have you seen how big they are?
Yeah. I noticed. I didn't want to say anything. Okay. I was a little jealous.
Don't need to train them, but if I train them, they don't get bigger.
So you get what you get.
You get what you get.
Okay.
They're exactly the same measurement they were 10 years ago, 18.5 inches.
Yeah, you did tell me that. Yeah.
All right.
That's fascinating.
This is a genetic condition that can make someone muscular, but also there are other side effects with the CAV3 gene.
Yeah.
Enlarged
tell me about
tongue.
Really?
Yeah. Heart problems. I forgot exactly what.
Okay.
All right. And then another thing I had, which has gone away since, muscle rippling syndrome. You stretch and it goes...
Fasciculations,
It's crazy, bro. I used to do it in front of my friends. I'm like, watch this, bro. Boom. And
they're like, ah.
Yeah. Yeah. So it's all part of this condition.
Fascinating.
Okay. This tends to be like flared with autoimmune conditions.
Interesting.
Right? This is going to sound super tinfoil hat.
Yeah.
Right. But this is my experience.
Huh.
I got COVID in 2021. All right. And I had where you lose your smell.
Yeah.
and then lose smell and taste, and then things started tasting different. Like coffee started tasting like poison.
Yeah.
It was really odd.
Weird.
The thing that I've had since then, all right, that's stayed with me, all right, I get a swallow reflex. Now, this happens after intense exercise and just at random certain days, but it's like it feels dangerous. You feel like you can't breathe. So you imagine continually swallowing.
Yeah. So it's involuntary
swallowing.
Just you have to swallow. Was it one time or just multiple times?
Constantly, and I have to breathe through the nose because if it's after a set, it happens a lot.
Interesting.
And it's stuck with me now.
Yeah.
But since then, my RMD, I haven't had a flare since. I have not had one since.
Weird.
Call me crazy.
Okay.
All right.
Do you still have the rippling thing?
No.
Nothing.
It hasn't come back since.
Okay.
It's like it changed something in my immune system.
That's so bizarre.
Super bizarre.
The spike proteins got in there and did something. Right? Yeah. So these are these weird, unexplained things. Patients ask me questions like this all the time. Explain X, Y, and Z to me. And, I can't explain it, of course. And, I think but one of my mentors years ago was like, listen, there's just going to be things like, you stop trying to explain everything. You'll drive yourself crazy. There are many things that there's no explanation, or there is an explanation, but you're never going to find it. So there's weird things about it. I have a lot of respect for what we don't know about the human body.
Yeah.
So even with the stuff that I deal with every day, like atherosclerosis, like there are a lot of people out there that think we have that figured out, and I'm like, no, like we don't even know what we don't know about it. We have a lot more to learn about it. So you have to be humble in medicine, because what we do know is this tiny little fraction of what is to be known. And what's going on with you is somewhere in that unknown, and we probably will never know. So
super
things
crazy.
are weird. Human body's weird, and genes are weird. It's weird. It's just weird.
It's super
just
weird, right?
It's just weird. Like, why does one drug work on someone and another person it doesn't? I don't know. It should work, but it doesn't.
It's odd, especially when they're very pharmacologically deterministic. And then you see
they've got a mechanism, same species, same person, same physiology, but not really. Something's up.
Can we touch on we have time? Yep.
Yeah.
GLPs.
Oh yeah.
But I have a specific question for them, because everyone talks about these drugs.
They're great drugs.
Right? To lose weight. Yep.
Yeah.
I get it. They're relatively safe versus their harm risk.
Exactly.
All right?
Everything. I like how you put that. Everything is risk benefit.
Risk benefit.
Yeah. Everything's risk benefit.
What do you say to people that are talking about the unknown unknowns with the GLP-1s that I think in recent times we are seeing a little bit more because more people are using them?
Yep.
Is there anything you're particularly worried about, like Broderick is?
I'm a little worried about the cancer risk down the road. There's a small signal there in the data, but is that going to pan out? I don't know. But I think we're going to have an answer to that pretty soon, just because of the volume of people. There are millions and millions of people. I see people all the time in the emergency room coming in that are on GLP-1s. I mean, it's covered by insurance here. Everybody's taking them, whether they're prescribed or not prescribed. So we're going to have some answers to those data. So do I have some concerns? Yeah, absolutely. Absolutely. So when it comes to GLP-1s, the way that I like to use them is in a very structured program for a very limited amount of time, and I prefer to microdose. I don't like to use the recommended dosage right out of the gate because, I just seen too many adverse effects from it. And I really do think that you can get the same benefit with a much lower dose, especially if you're just looking for body recomp, which is what most people. Now, if you're a totally out of control type 2 diabetic, hemoglobin A1C is 14. Okay, maybe I need to rapidly get you up to a good dose. But, if you're just looking to drop 20 pounds, let's do that nice and slow. Let's microdose it. Let's do things safely. And I'll just keep an eye on you. Yeah. But I think they're great drugs. They're a tool. They're just like every drug is a tool. And, you fit the tool to the job that you want to accomplish. So,
okay.
Yeah.
It's a great answer.
Yeah.
I have my own concern. I want to ask you about it.
What is it?
If you look at the studies, all of them, even with, what's it called? The other one, tirzepatide.
Yeah. That's the big one. Yeah.
I don't know why no one's talking about this.
Yeah.
I suppose I'm just that heart guy. even when they lose up to 25% body weight, the average increase in heart rate is 1 to 4 beats.
That's right.
When you lose weight, you're supposed to dramatically drop your heart rate.
Right. But
how come people aren't talking about
there's
this?
GLP receptors in the heart, and it makes sense that, I don't know the exact mechanism and where they are concentrated, but the conduction system of the heart, that the automaticity, they call it, from the SA node, all these electrically active cells, they probably have GLP-1 receptors.
Wow.
So it makes sense. You're stimulating those, and they become more active. It makes sense.
That's not a good thing.
Well, 1 to 4 beats, is something that you can tolerate probably, but is it permanent? That's a problem.
After a year of the study, that's the end result.
But they're still on the drug though, right? Like when they withdraw the drug, if it goes back to normal, then, on a case-by-case basis, I'd want to know about that, but I wouldn't be as worried about it. But if it's
normal's
permanent,
not good. These are the patients between 80 and 100 beats. You want that to come down.
You're right. And so again, this is pick your poison, right?
Yeah.
So are you willing to tolerate the potential problems of having maybe you go from 89 to 95 versus, the benefits of losing 40 kilos?
That's high. People have heart rates that high. Like this is in their studies
all the time. Yeah.
Like 100.
Oh, well, yeah. I see it all the time. I see people routinely with sinus tachycardia all the time.
Well,
it can't be good.
How do they sleep?
I don't know. I don't know. But surprisingly, I see people with heart rates of 150 in AFib, and they don't even know that they're in it. So it's highly variable. People tolerate heart rates.
That's insane,
it's crazy.
bro.
Now, those people are rare, but yeah, you'll see people with atrial fibrillation walking around, come in, and it's an incidental finding. Bro, do you know your heart rate's 135? Oh, I had no idea. And you're like, they're just cruising along in atrial fibrillation. So it happens. It happens. It's a problem. It's not good. They're going to get a cardiomyopathy from that. But again, this is risk benefit, just as we were talking about before. Every drug has side effects. Sometimes their side effects are why you're taking it. You want the side effect, but there are potential adverse effects to every drug. So you're just weighing, is this extra heart rate, is this heart rate increase going to kill you, or is this 50 pounds of visceral body fat going to kill you first? It's probably the fat. It's probably the worst thing, and so maybe we can allow you to have a slightly higher heart rate for a period of time in order to get this fat off, and then address, whatever residual risk you have.
Sure.
Yeah. But no, that's a thing.
It's a real thing.
It's a thing. Yeah. Patients don't complain about it.
But
rarely,
it's there.
But it's there. Yeah. It's, I've never had a patient, complain of like palpitations and stuff on it, but it is possible. Yeah.
So that's like, it's cardiac tissue working harder, faster. And I think to myself, given the option, let's say I just could not put the plate down or the fork down, right?
Yeah.
I'm probably going to go for some sort of lap band. That's what I'm thinking.
Yeah.
You know what I mean?
Or there's, similar options. Yeah. Something mechanical.
That's a great way of putting it. Because, from what we see in like the kind of like the large scale meta-analyses, the people with the higher heart rates over time, man, they just die way earlier.
Well, right. Over, years and years and years. Yeah. In general, it's a marker. A lower heart rate tends to be a marker of better health, right?
Yeah.
It's an association. It's an association between lower resting heart rate and a better overall health and longevity. Yeah, no doubt about it.
I wonder what the HRV is, these guys on GLP-1s.
That's a good question. Somebody should do that study.
Well, I've seen some forum data.
Yeah.
This is just anecdote.
Yeah.
And what do you think is the case?
Yeah,
it's lower.
Yeah. And it's sustained high.
Yeah.
Yeah.
So there's some sort of cardiac interaction there. Now, me being the last drug I ever tried was Ozempic. Didn't have access to tirzepatide.
Right.
I lasted a week. I did a 10th of the dose.
But with your gut issues, like,
bro, that was it.
Bad idea. Super bad idea.
You know what it felt like?
Yeah.
Dara was like, "What's wrong?" I was like, "I just feel like nothing's moving."
Yeah, because it wasn't.
Like I feel like I ate 30 minutes ago. It's 8 hours later.
You're like a snake. Yeah, you eat every 6 months. Yeah.
That was the biggest issue for me. I've already got what is known as slow digestion. And the reason a lot of that is from overfeeding, obviously being so heavy, but you know, these immune conditions can just slow down peristalsis.
For sure.
I think it's like super normal.
For sure.
Everyone has different transit times, right?
For sure. Yeah.
And so for me, that was the reason why I stopped it. But I just wanted to ask you, because you're the heart guy, is this going to be something that you're like looking out for in future, or honestly, you just think, well, cost to benefit, whatever?
I mean, everything, it's a cost benefit analysis for sure. Yeah. And, you know, again, I'm not going to prescribe those drugs willy nilly. If I'm going to prescribe those drugs to people who are, their health is acutely threatened by their obesity. They need to get the weight off. And that's what's getting them. Yeah. That's
big people. Yeah.
People with fatty liver disease who have a lot of liver inflammation. You know, they're going to develop cirrhosis if we don't fix this. That's going to kill them, not this increase in heart rate. Okay. So that's how I like to use those drugs, not for necessarily the cosmetic population out there that wants them.
Beautiful.
So
we're wrapping up, but before we wrap up, just one question. Okay. That's one tool in your toolbox. Yeah. We discussed many tools today. 5 tools. All right. You've only got 5. And then why pick 5? Humans can't remember a lot of things, bro.
Yeah.
Okay.
But you got 5 fingers.
But you got 5 fingers. Yeah. Exactly. You go pop, pop.
Yeah.
All right. Could be a drug. Could be an exercise modality. Could be a sleep tip.
Okay.
5 to reduce everything we spoke about today. Go.
Okay.
It's tough.
All right. It is tough. It is tough. Quality sleep. Absolutely quality sleep. Quality nutrition, quality relationships.
Wow.
Yeah, that's a big one. People don't think about that, but like, now I don't just mean your spouse. Like as men, you have to have a group of, you got to have your bros. You got to have your bros, people that have your back, people you can trust in life. There's longevity data on people that have like happy, long marriages. You know, that's a good thing. Hormonal optimization, testosterone, you got to fix that. And then high intensity exercise.
There you go.
But if you can do zone 2 if you want.
No, it's high intensity over zone 2.
Yeah. So those are like, again, if how much does it cost to do that? It's not very much, right? Now it is a lot of work. Keeping good relationships takes constant work, but you just do those 5 things, you know, that'll get you 90%, you know, and then if you want to do the other, you know, the 10%, like we talked about, you can take it to the next level, but just do those things. Oops, sorry. Then
very interesting.
Then that will get you most of the way there, and you'll have like a more happy, balanced life. I think, you know.
I can't disagree with that.
Yeah. Would you add any on there?
I wouldn't add any. Well, I'm not the health professional, so.
But you got another 5 fingers. You got 10 fingers. So.
Well, I would actually say the same thing. I would just double click on 2 of those for the audience. With the relationships, let's invert. When they go wrong, what happens physiologically? Talk about stress hormones, glucocorticoids, just real quick.
Well, have you heard of something called broken heart syndrome?
No, what is that?
Yeah. So it's a real thing in the cardiology world.
Never had it.
Yeah. I hope you never do. But you know, people literally come in with heart failure, and you know, EKG changes after a severe emotional distressing event. Like they literally and figuratively get their heart broken, and it can be fatal. Yeah. So you can die of a broken heart. It's called broken heart syndrome.
Bro,
Google that.
That's incredible. You know what I've been worried about the most? My bubba is dying any day, minute now. She's in her mid-90s. It's time. Yeah. But watching my father, him go through it, being 65, not sleeping, the stress, I'm worried for his heart.
Exactly. Yeah, that's his mother you're talking about.
Yes, his mother.
Yeah, that's hard. Yeah, I just, my father just passed away not that long ago, just a couple months ago. Yeah.
Bro, I didn't know this.
Yeah, at 92 though.
Sorry to hear that, man.
No, it's okay. Yeah, thanks. But it's been tough for me watching him decline. You know, over the years, and he exceeded all expectations. You know, we had him in the grave like 20 years ago, so he outlived all of our expectations. But yeah, it's hard to watch your loved ones decline, and especially in the last month of his life, which thank God I got to spend time with him there. You could tell he was ready. Like he just he was tired. You know, he was tired. He was not quite the same guy that I remember. And we all are going to reach that point if we're lucky.
If we're lucky.
If we're lucky.
92,
Yeah.
man.
Yeah,
if you've got
yeah.
a 9 in front of
Yeah.
your age,
Yeah.
that's good going.
Here's a story that gave me goosebumps when my mom told me the night he died. Before they went to bed, he said, "Honey," he's like, have I fulfilled all my obligations?" And she said, "Yes." He was dead 2 hours later.
Oh my God, that
Yeah.
is chilling.
That's the kind of guy he was, you know. Have I fulfilled my obligations?
Sounds like
Yeah.
just, you know, from that
Yeah.
one line,
Yeah.
I already know what he's about.
You already know what he's about. Yeah. Yeah. He was a legend, man. I would love for you to get to meet him.
Wow.
But it's hard to watch somebody like that who is as a kid, that's your superhero.
Yeah.
You know, and then, you know, you see them decline. But he's, you know, he's one of those old school guys, never complained, tough as nails, but just like a really good man, good father. So he's my prototype. He's my role model.
What a legend.
Yeah, total legend, man. I could tell you stories for hours.
Shout out to your dad and my bubba.
Exactly.
Who's of the old school
The
Croatian bubbas.
old school Norwegian.
You know?
On my dad's
there you
side.
go.
Yeah.
Wow.
Yeah. So it's hard. You know, it's hard. But we're all going to go down that path. So.
Well, I hope you guys enjoyed today. I certainly, that was a good chat.
Fun. It was good.
Yeah.
I've lost track of time.
Bro, we went past 3 hours.
Ooh.
It just happens like that when you're in a flow.
Yeah. Absolutely.
You know?
So we'll have some good material.
Definitely.
All right, cool. We'll be able to salvage something out of it.
Beautiful.
Thanks, brother.
Thank you, man.
So much fun. I'm gonna bang on the table now.